I'm sorry, Dr. Shushmoy.
Okay. Shall I start?
Just a minute. So again, let's start from the beginning as this session is recorded. So in this session, Dr. Shushmoy will be given a case and I will be the surrogate, and Dr. Biplab is going to act an examiner. And Dr. Biplab has to give her his valuable comment and mark according to the mark sheet. So Dr. Shushmoy is going to have a case now. So Dr. Shushmoy, we can start
Yes.
again.
Oh. Hello.
Hello, doctor.
This is Dr. Sushma, one of the doctors working here today. Are you Mrs. Hena, 35 years old?
Yes, doctor. I'm Mrs. Hannah. I'm 35 years old.
Okay. Nice to meet you.
Nice to meet you, doctor.
Okay. I am here to talk about your problem and I will examine you. Is that okay with you?
Yes, doctor. It's okay.
Okay. During my consultations, I might need to take few notes, but rest assured, everything would be confidential.
Okay, doctor.
Okay. So, Mrs. Hena, so what brings you here today?
Doctor, actually, I'm having loose motion for the last 3 days. It started suddenly and it is not getting improved, doctor. I need some help. Please help me, doctor.
Okay, I'm really sorry to hear about that. Let's see how we can help you today.
Okay, doctor.
So, you mentioned that it's there for last 3 days. Can you please tell me what do you mean by loose motions? Like, at this moment, how many times you need to go to the loo, or before, what is your usual bowel habit?
Doctor, earlier I used to go to the washroom one day in every day, once per day. But right now I have to go to the washroom 7 to 8 times, doctor. It's really very much distressing.
It must be really distressing you. I'm
Yes,
sorry
doctor.
for that. Can you please tell me the nature of the bowel work? Like, is it watery or bloody?
Doctor, it is completely watery, doctor.
Okay. And like, is it like greasy or pale color, which is
No,
stick
doctor.
to
It's
the pan?
watery. It's watery, doctor.
Okay. All right. Okay. And is this the first time that you are having this type of problem?
Yes, doctor. This is the first time.
Okay. And could you remember like anything that triggers your diarrhea? Like, did you take food from outside or any kind
Actually,
of
doctor,
food?
I love outside food. I
Mm-hmm.
used to take food outside, doctor. Yes.
Mm-hmm. Okay. So can you please tell me more? Like, when did you take the food and what kind of food you take?
I took some local street food, doctor, 4 days back.
Mm-hmm. Okay. And have you noticed anyone surroundings you have the same problem?
Doctor, actually, I was the only one who took this food.
Okay. All right. Okay. And have you noticed like fasting or avoiding certain food improving your diarrhea or loose motion?
No, doctor.
Okay. And does this loose motion wake you up at night?
Yes, doctor. This is very much distressing, doctor. I have to wake up at night many times.
Okay. I'm so sorry to hear about that. And have you got any have you got any sense of incomplete ending of your bowel work?
No, doctor.
Okay. Have you got any sudden urge to go to the loo that you cannot hold it up?
Yes, doctor. I feel like that. I have to go to the washroom every now and then. And whenever it comes,
Hmm.
I have to go to
Hmm.
the rush.
Okay. All right. And in between these loose motions, have you noticed any hard stool?
No, doctor.
Okay. And do you feel dizzy while you stand up?
Yes, doctor. I'm feeling so.
Okay. All right. And you mentioned it is the first time that you're having this problem, right?
Yes, doctor.
Okay. And do you have any long-term medical condition that I should be aware of?
No, doctor. I was completely all right.
Any high blood sugar or any high
No,
blood
no.
pressure?
Nothing like that,
Oh,
doctor.
all right. Okay. Did you have any previous hospital admissions or any surgeries?
No, doctor.
Okay. Any medical procedures or any
No,
dental
doctor.
procedures?
No, doctor.
Any history of blood transfusions?
No, doctor.
Okay. Any recent illness?
No, doctor.
Okay. Mr. Sanina, are you taking any long-term medical? Are you taking any medicines?
No, doctor. I'm not taking any medicine right now.
Okay. All right. Any over-the-counter medicines?
No, doctor.
Any herbal medicines?
No, doctor.
Okay. Do you have any allergy to any medicines?
No, doctor. Excellent question.
Okay. Okay. Anyone in your family having any bowel issues?
Yes, doctor. My father died of bowel cancer.
Okay. I'm so sorry to hear about that. At what age he died?
He died at 45 years of age.
Okay. All right. And a few more questions. You can answer this in yes or no so that I could make sure that I'm not missing anything. Okay.
Okay, doctor.
Okay. Do you have any eye pain or any redness?
No, doctor.
Okay. Like any joint pain or any rash?
No, doctor.
Okay. All right. Do you have any weather preferences?
No, doctor.
Okay. Have you noticed any changes in your weight?
No, doctor.
Okay. Any lumps or bumps anywhere?
No, doctor.
Do you have any skin thickening?
No, doctor.
Okay. Any changes in your appetite?
No, doctor.
Okay. Do you have any fever?
No, doctor. I don't have any fever.
Okay. And is this diarrhea associated with the tummy pain?
Yes, doctor. I feel some pain at my tummy.
Okay. Where exactly?
Patient is showing the right lower side of the tummy.
Okay. Right, lower side of the tummy. Okay. And can you please tell me what kind of pain it is?
Doctor, it is crampy pain.
Okay. On a scale 1 to 10, how you grade your pain?
It is about 4 out of 10, doctor. It comes and
Okay.
goes.
All right. Since when?
Since the same period for the last 3 days.
Okay. All right. And does the pain go anywhere?
No, doctor.
Okay. And do you have any vomiting or any feeling sick?
No, doctor. Yes, doctor. I
Okay.
feel sick, doctor. But I have not vomited yet.
Okay. All right. All right. And okay. Do you have any problem with the waterworks
No, doctor.
or like any burning sensations or any
No,
increased
doctor.
frequency of the? Okay.
No, doctor.
Do you have any heartburn?
No, doctor.
Okay. All right. And may I ask, do you smoke?
Yes, doctor. I smoke.
Okay. How much?
About 10 cigarettes per day.
Okay. So for how long?
For the last 10 years, doctor.
Okay. So, Mrs. Hannah, I would like to mention that smoking is not good for your health. So, if you want to quit, then I would refer you to the respected department for you.
Okay, doctor. Thank you
Okay.
for that.
Okay, thank you. Do you drink alcohol?
I drink socially, doctor.
Okay. Is it within the social limit?
Yes, doctor.
Any episode of binge drinking?
No, doctor.
Okay. And I'm sorry to ask, do you do any party drugs?
No, doctor.
Okay. Any drugs through your blood channels?
No, doctor.
Okay. All right. Few personal questions I need to ask.
Sure.
Are you sexually active?
Yes, doctor. I have my boyfriend.
Okay. Do you practice safe sex?
Yes, doctor.
Okay. I'm sorry to ask, by any chance, do you have any other casual partners?
No, doctor. I don't have.
Okay. Any recent travel to anywhere?
No, doctor.
All right. That's okay. And do you have any tattoo or any piercing?
No, doctor.
Okay. All right. And then, Hannah, may I ask you what do you do for living?
I'm a banker, doctor.
Okay. And how this is affecting you?
Yes, doctor. It is affecting me a lot. I cannot attend my job due to this loose motion, doctor.
Okay. I'm so sorry to hear about that. And we might involve the social services and occupational therapists that might help you in this case.
Okay, doctor.
Okay. And do you drive?
Yes, doctor. I drive.
Okay. All right. So I would like to mention that as you feeling dizzy, so it's good if you not drive till further assessment.
Okay, doctor.
Okay. Thank you very much for giving me all the information. I'd like to examine you.
Okay, what you
Right
want to
with you?
say? Yes.
Okay. So I would like to start with the abdominal to check the abdomen examination, to check the superficial palpation and deep palpations.
There is pain at the right lower tummy on deep palpation.
Okay. And I would like to check whether there is any ascites presence or not.
Absent, doctor. 2 minutes left.
Okay. So I'd also like to check the bowel sound.
Normal.
Okay. And would like to check the general examinations. Is there any anemia or any jaundice
Absent.
presence or not?
Absent.
Okay. Okay. I'd like to check the postural blood pressure.
Postural drop is present.
Okay. All right. So, Mr. Sena, thank you very much for letting me examine you. So, can you please tell me, like, what is your concern?
Doctor, why I'm having this loose motion?
Okay, I really appreciate your concern. It could be due to some bug infections in your tummy. Sometimes, whenever you eat outside, it might cause some bug infection. That's why you might have this diarrhea. Okay.
Doctor, is it cancer like my father?
Well, at this moment, it's very unlikely that you have cancer, but we just need to run some tests to exclude this thing.
Do I need admission, doctor?
Well, at this moment, we'd like to admit you because as you feel dizzy, we'll give you some fluids to your blood channels and we'd run some tests.
Okay, will it get cured?
Yeah, most likely with some fluids and taking rest, as your problem would be cured, but we need to run some tests as to find out the exact cause of things. After that, we'd be in better positions to tell you exactly.
Okay, doctor. Thank you, doctor.
Do you have any other concerns?
No, doctor. Time's up.
Okay.
So, doctor, do you have any diagnosis or differential diagnosis?
Well, I have some differential diagnosis.
Okay, what are they?
It could be due to some infection.
Okay, then?
Then it could be due to celiac disease.
Celiac disease, 3 days diarrhea.
Oh, sorry. Then it could be, I know I use. Well, it could be first episode of IBD or IBS.
Okay. Why IBS, doctor?
The patient is complaining tummy pain.
Yes. Anything else?
And
in favor of
lose
IBS?
motion.
Was there any stress there?
I forgot to ask about this too.
Is the tummy pain improved after opening the bowel?
No.
Did you ask that?
No.
And is the IBS loose motion present with 3 days diarrhea, acute diarrhea?
No.
Okay. Anything else you want to mention? You want to rule out?
No.
Okay, doctor. So what are the positive physical findings, doctor?
Patient is having
just
tenderness.
Try to practice, just a pause, doctor. Try to practice not to mention the term patient. Try to practice not to mention the term patient. To prove you professional, just mention young lady or middle-aged lady.
So on examinations of this lady, I have found that there is some tenderness in the right eyelid fossa, right eyelid fossa, and patient is having postural hypotensions, and I didn't find any other positive findings.
Are you sure, doctor?
Yes.
Okay. So how would you like to investigate?
Okay. I would like to run some routine test, and apart from the routine test, I would like to do the stool examinations and some inflammatory markers like fecal calprotectin.
Wonderful.
And then and I would do some blood test as like CBC, serum creatinine, electrolytes, and also do the urea electrolytes.
Anything else?
No.
Okay. So how would you like, suppose this patient has come to you at the emergency department. How will you manage this patient or this immediate lady?
Okay. I would like to, first of all, I would like to go according to the ABCD approach. Or then I would start the fluids for the IV channels, and then I'd also mm, mm, then I would form the multidisciplinary team and education and counseling. Then
Yes.
treatment depends on the cause.
Wonderful, doctor. Let the examiner ask the question. Just mention then treatment of the underlying cause. Then the examiner would ask you, suppose the underlying cause is infection. What will be your treatment?
Okay, in that case, the treatment would be the fluids and rest.
Okay. Anything else? Do you want to start any antibiotic?
No,
Why?
because most of the diarrhea settle without antibiotic.
Yes. Yes. But to be in the safe side, you can just tell that I would like to take consultation from the infectious disease department. And
Okay.
this is their duty, whether you will start antibiotic or not. And for passing the exam, it is not needed to memorize the name of the antibiotic because it is a multidisciplinary approach. I'm telling from my personal experience, I got a case of meningitis. The British examiner asked me, what is the antibiotic? What are the choices of antibiotic? I just replied this question, this answer, that I would like to take consultation from the infectious disease department. And they gave me full mark. So, doctor,
Okay.
your performance is over. Now, let's start giving judgment. So, Dr. Biplab, are you there, doctor?
Yes, sir.
So, doctor, let's start giving the judgment. So, it will be written like this, loose motion in the mark sheet. So, based on Dr. Shushmo's performance, what will be your judgment in physical examination?
Uh, he did very well, sir. But just
Yes,
few things I think.
yes, doctor.
First of all, I'm not sure there was right hypochondriac pain or right iliac fossa pain. I got confused in that
Right,
first
iliac
thing.
fossa pain, doctor.
Iliac fossa pain. Okay, sir. So basically, I think he checked vitals later and he started with abdomen first. I think he should have started with postural hypotension earlier. Check for signs of dehydration.
Actually, in the PACES
Uh,
exam, they are not bothered with the sequences. They just
okay, sir.
want what you are covering or not. You can start with tummy
Oh,
or you can start with vitals. Anyone will do.
okay, sir. Okay. So that was a good performance. Postural hypotension, I'm not sure if he asked or not.
Yeah, he asked it
Um,
and
and
it was present.
yeah, yes, sir. And signs of dehydration.
Yes,
These
doctor.
two things
Did you
I
miss any signs of checking any signs of dehydration?
uh, tongue saw, but
Yes.
skin turgor maybe.
Skin target is not allowed in PACES exam because it will go
Okay,
against the welfare. You cannot pinch the
okay,
patient's skin, and but you have to
okay.
check the tongue. It will be dummy case.
Yes.
You will not never find any dry tongue, but the examiner will see whether you are seeing the tongue or not. Are you getting it, Dr. Shushma?
Yes. Yes, sir.
So you have to act to check for the tongue to the examiner. And Dr. Biplab has wonderfully identified that you missed to check the tongue, but wonderfully you check the vowel sound. So Dr. Biplab, anything else you want to add?
Uh, no, sir. Apart from that,
Did you
I think
examine
it
the
was.
abdomen looking for organomegaly?
He did superficial palpation.
Yes. But there is a
Is there?
family history of bowel cancer.
Yes, sir.
So we should go for at least hepatomegaly. He has checked for ascites, but
Yes.
I'm not sure
Uh,
whether.
One thing I would like to mention, I asked about the deep palpation.
Okay. Actually, I could not get it. In the deep palpation, you have to mention whether you are ruling out any organomegaly or not. So you were looking for organomegaly, right, doctor?
Yeah. Deep palpation means I would like to look for an organomegaly or anything.
Okay, then it is okay. So, Dr. Biplab, anything else you want to add?
Not really, sir.
Okay, so based on this, what will be your judgment?
Satisfactory.
Yeah, it is mostly satisfactory. Because what happens in the exam, we usually will never miss to check the tongue. It is true for every case. But Dr. Shushma, be careful of that. Although you have checked the vowel sound, which is the most common mistake in the for this prompt, but never forget to check the tongue. Got it, doctor?
Okay.
Okay. So the next skill, Dr. Biplab, identifying physical signs. What will be your judgment?
Satisfactory, sir. Like,
Yes, doctor, satisfactory.
Yeah.
It was a dummy case, and only the right lower tummy pain and postural drop was there. And sometimes the examiner can try to make you synthesize some finding, like I did. I asked Dr. Shushma, are you confident? Are you sure you are not missing anything? So be confident of yourself, doctor. So it is satisfactory. Then come to the clinical communication skill. What will be your judgment, doctor?
I think, sir, maybe he did very well. But
Yes,
if you want
doctor.
to point out, sir, maybe he didn't ask about waterworks, if I am correct.
He
Like
asked it,
whether
doctor.
you are passing urine.
He asked it.
Okay, sir. And the tummy pain, he didn't explore it as per Odipara.
He asked it, doctor. Tummy pain.
Relieving.
He
Yeah,
asked it,
but
doctor.
Odipara accordingly.
Oh,
Yeah,
he asked
okay.
site, onset, but he didn't ask anything relieves this pain. But it is okay, doctor.
Yeah,
Actually, this is a long prompt.
yeah. Yes, sir. Obviously.
And actually, this case has come in the last third diet at Delhi Center. Exactly the same thing. And I'm very much happy that Dr. Shushmoy asked the medication allergy. There was a doctor named Dr. Partho. He was one of the candidates of this course. He attended the Delhi exam that day, and he got this case. And there was positive penicillin allergy. Although I did not give the same history to Dr. Shushmoy, but in this case, there was a history of penicillin allergy. And never forget to ask for medicine allergy for this reason. And anything else, doctor, you want to mention?
No, sir, I think he covered most of the things.
Okay. So it is, what will be judgment, doctor?
Satisfactory.
Yes, it is satisfactory. Then in the differential diagnosis?
Maybe the acute gastroenteritis was definitely the first DD. Maybe I might have put
Yes, he
appendicitis
mentioned
also
it.
as it.
He mentioned the infection. Infection means acute gastroenteritis.
Yeah, and second DD I might have put appendicitis maybe down the
It is
list, but
right.
there was no.
It is right, but in ruptured appendicitis, it will be acute abdomen.
Yes.
And actually, we are dealing medicine case. PACES is a medicine exam. So less likely to give surgical case.
Yes.
In case of appendicitis with loose motion, it has to be ruptured to and the collection has to be there in the pouch of Douglas. Then there will be loose motion. So very less likely, doctor.
Yes. Just a DD, nothing else.
Yeah, just a DD. You can mention, but better to mention the easy diagnosis first because they want you to rule out the easy ones first. Anything else apart from he has mentioned infection and IBD? Anything else you want to add, doctor?
Cancer.
Yes, cancer. He has missed this. And this thing was there in the Delhi Center. His father died of bowel cancer at the age of 45. It was an earlier age. So we have to start screening for this person. Are we getting it, Dr. Biplab and Dr. Shushma?
But it was too early age. Like
3 days diarrhea, sir.
3 days diarrhea and
yeah. That is why it will be the third differential diagnosis that we want to rule out the bowel cancer. Because it can be the first presentation of the alteration of bowel habit. It is less likely, but as there is family history of bowel cancer, we have to mention that we want to rule out bowel cancer by doing the screening, screening colonoscopy. And in the clinical judgment regarding the investigation, we have to mention it, that we have to do the colonoscopy there. That was the reason why bowel cancer history was given in this case. Are you getting it, doctor?
Yes.
That is why in the GIT prompts, I have mentioned that never forget to ask any family history of bowel cancer. This is less likely to be bowel cancer, but we have to put it in the last DD that we want to rule it out. So it is less likely, but as that's family history of bowel cancer, and this is younger age, so we have to rule it out by doing the colonoscopy. And if you see the guideline, having bowel cancer at 45 is very much risk sign. So we have to refer this patient for screening. And Dr. Sushma missed this bowel cancer. Are you getting it, Dr. Sushma?
Yeah.
Dr. Biplab?
Yes, sir.
So what will be your judgment in DD?
Satisfactory.
No, doctor, it will be borderline. Missing one DD, it will be borderline, doctor. You are becoming too much liberal. So can I give doctor borderline?
Okay, sir.
Okay. Then in the clinical judgment?
I think did he mention stool routine and culture? I am not sure.
He mentioned the stool routine and culture. He mentioned it.
Okay.
Stool study. At the very beginning, he mentioned it. But he did not mention the colonoscopy.
Yeah, because bowel cancer was not the DD, so that's why.
Yeah, that is why.
Yeah.
That is why you will understand once you practice giving mark, you will understand how each skill is related to one another. Because if you miss one DD, automatically mark can be cut in the clinical judgment because you will not mention the investigation there. That is the reason you have to practice giving mark to each other from the given homework.
Doctor, even for IBD, colonoscopy is important.
Yes, colonoscopy is necessary. But after doing the fecal calprotectin, Dr. Sushma has mentioned it. We have to mention the non-invasive first, then going for the invasive. So, Dr. Sushma, could you identify your mistake, doctor?
Yeah, sure.
So it will be colonoscopy was missed. Otherwise, all the things was wonderful. And this was the exact question which was asked by the British candidate to the Delhi doctor. British doctors to the Delhi candidate. He asked that, suppose this patient has come to you at the emergency department. How will you manage this? Dr. Sushma has given a wonderful answer. Only small mistake, he didn't mention the colonoscopy.
It's very less likely. That's why, like 3 days history, I didn't get it.
Yeah, no problem, doctor. From now on, just remember in the GIT prompts, if anytime you get any family history of bowel cancer, try to rule it out at the last. Just mention that I want to rule it out. Got it, doctor?
Okay.
So it will be borderline. Then managing patient consent, Dr. Biplab?
Good, sir. Satisfactory.
Yes, satisfactory. Welfare is also satisfactory. And another trick is there, I will suggest, after completing the examination, do handshaking with the patient, give the patient thank you. If possible, say 3 times. That thank you, sir. Thank you very much. Thank you, ma'am. You have done a wonderful job for me. And whenever you are removing the gown, try to help the patient to put on the gown. Whenever you will try to put on the gown, the surrogate will come and take the job from your hand. But this will give a good signal, a positive signal to the examiner that you are professional and careful enough about the patient. And sometimes if you can create a good impression, they might consider some of your mistakes. That is why creating a good impression is very much essential. Whenever you are entering the room, try to give a smile, looking at the face of the examiner. Say them hello. These are some common techniques to have a good impression to the examiner. And British doctors like smart examiner. You may not be clinically so much perfect, but they prefer whether you are confident and smart enough. So, Dr. Biplab, if we calculate all the marks from one examiner, what will be the mark out of 14 from this mark sheet?
Well,
how much would be?
12, no? 12, no? One,
yes,
one
doctor,
mark.
12, 1, 2. So during practice session with each other, we have to multiply this mark into 2. So it will be 24 out of 28, which I will suggest that regarding considering the first session, it is a very good mark, because I'm saying it from my personal experience that I have seen a lot of candidates starting with 8 out of 28, and they completed with 28 out of 28. So I will suggest that I will say that Dr. Shushmoy has made wonderful regarding the first session, but it has to be continued. Like every day he has to practice. Then it will be like every session he will make 28 easily.
Thank you.
Any question from
Thank you for your
side?
guidance.
You are most welcome, doctor, but you have to continue doing the practice. Yes.
One more thing. So if the family history is about 45 years, if it is more than 45 years, so we can exclude this thing, right?
Whenever there is any family history of cancer, to keep you on the safe side, just mention that I want to rule out the cancer. That's it. Always try to keep you on the safe side.
Okay. All right. Thanks.
Okay. Thank you, doctor. So now it's turn of Dr. Biplab. Right now, Dr. Biplab will be the candidate, and Dr. Shushma will be the examiner. I will be the surrogate.
Okay.
Okay. So now keep an eye on. So let me give a case to Dr. Biplab. So Dr. Biplab, this is your case. Are you seeing this screen, doctor?
Okay.
So you have 2 minutes time.
Okay.
Okay. Are you ready, doctor?
Yes, sir. Yes, sir.
Okay. Let's start.
Hello, my name is Dr. Viplav, one of the doctors in the clinic today. I'm speaking to Miss Olivia, 32 years of age.
Yes, doctor. I'm Miss Olivia. I'm 32 years of age.
Okay. Miss Olivia, today we'll be discussing about your problem and later on I will be examining you. Is that okay with you?
Okay, doctor.
So while our discussions, I'll be putting down few notes. Rest assured, those will be completely confidential. Okay.
Okay, doctor.
So Miss Olivia, what brings you here today?
Doctor, I'm having some swallowing difficulty for the last 5 days. It started gradually, but it is getting worse day by day. I really need some help, doctor. Please help me.
Yes, Miss Olivia, I hope I can help you at the end of this consultation. So, Miss
Okay, doctor.
Olivia, you told me that it started 5 days back, and
Yeah.
may I know how did it start? Did it start suddenly, or it built up over a time?
Doctor, it started suddenly, doctor. I noticed suddenly, doctor.
Oh, all right. Is this the first time that you had this?
Yeah, this is the first time.
Okay. Anything that kind of makes it better, like changing your posture
No,
or
doctor.
gulping down something?
No, doctor.
Okay. Anything that makes it worse, like if you lie down or any change in
No,
posture?
doctor. No, doctor.
Okay. Okay. May I know, is it more to solids or liquids or both of them?
Doctor, it is to both of them.
It is to both of them. Okay. Uh, do you feel pain while you swallow?
No, doctor.
Is it just at the initiation of your swallowing, or you feel that there is a lump in your throat, behind your throat, in your
Doctor, it
chest?
is at the initiation.
It is at the initiation. Okay. Uh, all right. Anything that do you feel like choking while you
Yeah,
swallow
doctor.
something?
Yes, doctor. I
Okay.
feel like choking.
Okay. Does it come back to your nose and
Yeah.
mouth?
Yeah, doctor. It happened for multiple times, like the fluid. Sometimes it happened with the food.
Okay. Do you feel like any pain behind your chest when you do this? You
No,
swallow?
doctor. No, doctor.
Okay. Okay. I'm sorry to ask, but do you feel that there is some bad breath, or people mention that there is a bad breath?
No, doctor.
Okay, okay. Uh, apart from that, do you have any chest pain? Sorry, any joint pains?
No, doctor.
Any mouth sores or
No, doctor.
face rashes over your face?
No, doctor.
Okay. Any tummy pain?
No, doctor.
Okay. How about your bowel works?
Actually, doctor, I'm not able to take food right now. So my bowel work has been diminished, doctor.
Yeah, I can understand. Any problem with your water works, like any frothy urine
No,
or
doctor.
any burning during your urination?
No, doctor.
Okay. Do you have any history of raised body temperature?
No, doctor.
Any lumps and bumps in your body?
No, doctor.
Any weight changes?
No, doctor.
Okay. Apart from that, do you have any weakness anywhere in your body?
I feel generally weak, doctor.
Generally weak. Is it that does this weakness has started for 5 days, or it's been there before as well?
I'm feeling it mostly for the last 5 days.
Okay. Is it prominent during any particular time of the day?
I feel mostly at the end of the day.
All right. Do you have any problem with your vision?
Yes, doctor.
Okay. But what exactly? Do you see double or any blurry?
Yeah, doctor. Actually, I am a typewriter. I have to work over the screen. And mostly at the evening, I see double.
I'm sorry to know that. Do you have any problem with your breathing?
No, doctor.
Any change of voice?
Yeah, doctor. My voice has been changed.
Yeah.
I feel like I'm speaking through my nose.
I'm sorry to know that. I hope I can help you at the end of this consultation. Do you have like pain or weakness when you stand up from sitting position?
No, doctor. Yes, doctor. I feel the weakness standing from the sitting position.
Yeah.
Okay, okay. Apart from that, do you notice any pigmentation or tanning of your skin?
No, doctor.
Okay. Do you think that your stools are pale, greasy, or difficult to flush?
No, doctor.
Or do you have any loose motions or tummy difficulty when you bread pasta or something?
No, doctor.
Any like white patches over your body?
No, doctor.
Oh. May I know, are you suffering from any long-term illnesses that I should be aware about?
No, doctor. I was completely fine.
Okay. Like, are you on any medications right now?
Yeah, I'm taking an antibiotic for a recent sore throat. My GP gave it to me.
Okay. When this sore throat occur?
It is there for the last 7 days, doctor.
May I know the medication which are you which
I'm taking the medication name azithromycin. Some noises come. Azithromycin, doctor.
Okay, okay, sir. Okay. May I know any weather preferences?
No, doctor.
Okay, okay. So, may I know, do you smoke? So, few personal questions.
No, doctor. I do not smoke.
Okay. Do you drink alcohol?
I drink alcohol, doctor.
Any binge drinking?
No, doctor. I do not binge.
And how much alcohol do you take? Like how many units, if you can
Doctor, I drink
quantify?
within social minute.
Okay, okay. May I know what do you do for your living?
Doctor, I work as a typewriter.
Oh, and has this affected your day-to-day activities?
Yes, doctor. It has affected me. I feel generally weak. I am not able to do my activities, doctor.
I'm sorry to know that. Maybe I can involve a social health worker and occupational health worker to help you out with that.
Okay, doctor.
May I know, do you drive?
Yes, doctor, I drive.
Miss Olivia, at this moment, you will need to stop driving since you have some problem with your vision. Is that all right?
Okay, doctor.
Okay. Few more personal questions. Like, do you have any long-term partner?
Yes, doctor, I have my boyfriend.
And any, sorry to ask, but any casual partners?
No, doctor.
Any problem with intimacy?
No, doctor.
Okay. May I know how are your periods?
It's regular, doctor.
Okay. Any change in flow recently?
No.
Okay. May I know, like, do you have children?
No, doctor.
Okay. Any abortions in the past?
No, doctor.
Okay. One more, a few questions. Like, any family history of similar complaints of swallowing difficulty or family history of cancer or any other
No, doctor.
disease?
No, doctor.
Okay. Okay. So I would like to examine her, and meanwhile, I would ask few questions along the way, if that's okay.
Okay, doctor.
Yeah. So you told me that there were no weight changes, right?
Sorry?
No weight changes, right?
No, doctor.
Okay. Okay. So basically, then I would like to start with her general appearance.
Okay, it is
Starting
showing
from
the picture.
Yes, sir. So basically, initially, I would like to start from hands to check for any tremors,
Absent.
any pallor or clubbing,
Absent. Absent.
any dupuytren's contractions, especially if alcoholic. Then check the flaps, then pulse, whether it's regular, irregular, radio, radial,
Normal,
body,
doctor.
step. Then I would please like to know the blood pressure and to check for any postural drop in blood pressure.
Absent, doctor.
Then I would like to check for proximal myopathy.
Present.
Okay. Then I would like to go further to the face and check for any pallor or icterus.
Absent, doctor.
Yeah. Then I would like to ask the patient to open the mouth to check for any oral sores.
Absent.
Yeah. So I would like to start with ceiling test, or I would
How
pick.
to do the ceiling test, doctor?
So basically, I would like to ask the patient to hold her hands up and look up and count from 1 to 30 and see
Yes.
if it
Yes.
her
Fatiguability
eyes.
present.
Okay, okay. Then I would like to check quickly do her visual acuity and
Normal.
H-shape movements
is-
as well.
H-shape movement is restricted and she is seeing double at both ends of the vision.
Okay. I would also like to offer fundoscopy at the end.
Okay, noted.
And I would like to ask the patient to smile for me.
There is my
So
is not present.
Okay. Would also like to check the facial nerve palsy, also asking the patient to close her eyes tightly and whistling
Then
and puffing the cheeks. Yeah.
there is overall
So,
facial muscle weakness. 2 minutes left, doctor.
okay. Again, I would ask the patient to take a sip of water and gulp it down when I say so to check for any thyroid swelling.
Absent, doctor.
And I would also like to do a retrosternal percussion for thymus.
Absent.
And then chicken winging test as well to see
Yeah,
if the
it is
patient
positive.
goes.
It is
Okay.
positive, doctor.
Okay. So quickly, I would like to just go to her tummy, do a superficial and deep palpation.
Normal.
Yeah. Okay. Okay. And just ask the patient to to count from 1 to 30 in a single breath. Single breath
Okay,
count.
noted, doctor. It
Yes.
is normal.
And chest auscultation also, and chest expansion also, sir. Be from behind.
Okay, it is normal.
Yeah. Okay. So, Miss Olivia, what are your concerns for me?
Doctor, why I'm having this swallowing difficulty?
Miss Olivia, from taking your history and later on examining you, I think you have a condition called as myasthenia gravis. Don't bother by the term. Basically, it is a disease in which the defense system meant to attack bugs is attacking your own body, and in this case, it is the lining of the muscles of your uh, food pipe, uh, and the nerve cells are weakened.
Okay,
Any
doctor.
other concerns for me?
Doctor, is it curable?
Miss Olivia, I'm afraid it is not curable, but it can be manageable with proper management, proper proper treatment.
Doctor, do I need admission?
At this moment, yes, Olivia, since there is problem with your vision, we'll need to monitor you and admit you, and we will form a team of doctors, a multidisciplinary team to take care of you. And at the moment, we will stop the antibiotic that you are taking, that is azithromycin, that could have triggered this. And yes, we'll
Thanks,
manage
sir.
you accordingly.
Thanks, sir.
Okay.
So, doctor,
Thank you, Olivia.
Thank you. So, doctor, do you have any diagnosis or differential diagnosis?
So I think the diagnosis is clear. It's myasthenia gravis, oropharyngeal dysphagia, secondary to myasthenia gravis.
Okay. So, do you have any differential diagnosis for this oropharyngeal dysphagia?
The patient could be basically this is ocular myasthenia, and also there is no
This is
history of
ocular myasthenia.
Because there is involvement of eyes also, sir.
Okay, so is it called ocular or generalized?
It's more of a generalized, sir. I'm sorry.
Yes, doctor. Never mention this term ocular. Because
Yes,
in the
yes.
exam, if you mention one wrong thing, the examiner will make you confused.
And also Lambert-Eaton myasthenic syndrome, but there is no family history of cancer or no weight loss as my second differential.
Okay. So what are the positive physical findings, doctor?
So basically, fatigability test was positive. There was external ophthalmoplegia. There was myasthenic snarl, and proximal myopathy was present. And yes.
So what is the problem, doctor?
Dysphagia.
So in the neurological dysphagia, which part of the body is mostly affected? How we can examine?
So
bulbar movement?
Yeah. Oh, yes.
So did
Pharyngeal.
you check, doctor?
No.
Say yes, doctor. So you have to open your mouth and say up for me. And one big mistake is that it is a case of neurological dysphagia. So this patient will cough and will have choking sensation if you offer fluid to her. So don't go for offering fluid to this neurological dysphagia.
Okay, sir. Okay.
Okay, it will go against the welfare.
Okay, sir. Okay.
Doctor, can you repeat?
Sorry, doctor?
Repeat the last words.
Okay, actually, this is a case of oropharyngeal dysphagia.
Okay.
So this patient will start coughing whenever he will be offered any food or any fluid. Dr. Biplab wanted to check the neck swelling, the thyroid swelling.
Okay.
But this will not be a true neurological dysphagia given at the PACES exam. This will be a dummy case. But the examiner will mark that in spite of saying it neurological dysphagia, candidate has offered water that can provoke some discomfort to the patient.
Thank you too much. Thank you, doctor.
Okay. So, doctor, any other positive findings? Dr. Biplab?
Sir, it's not really, sir. I might have missed something.
No, just tell me. In the eye, what did you got?
There was ptosis.
Yes, mention it. In
Yes.
the exam, you cannot look at the patient's second time. So, Just remember, in the eye, what you have got, in the face, what you have got, in the arm, what you have got.
Yes.
You have got the complex ophthalmoplegia. So you have to mention this.
Yes.
Okay, doctor. So, so how do you like to investigate, doctor?
So to confirm the cause, basically video fluoroscopy. Then I would like to do esophageal barium swallow. Sorry, would like to do a single nerve stimulation test, single fiber electromyography test, antibody testing like anti-musk antibodies and acetylcholinesterase antibodies. Then would to check for complications, would like to do a forced vital capacity, a single breath count test, and associations. Then would like to check for blood sugar levels. Would like to check for stool transglutaminase antibodies for celiac disease. Then would like to check for any what else? Uh, Plasma ATM cortisol levels to look up any addisons if there are any associations accordingly. And would like to admit this patient this time.
Okay, that is in the management.
Yes.
So how do you like to manage?
So basically, airway would like to admit her, manage her airway breathing and circulation. And at this moment, I will stop azithromycin. The patient would involve education and counseling involving a team of doctors. And accordingly, the patient might need pulse steroids or IVIG in this case.
Yes.
If the patient is in myasthenic crisis.
What kind of myasthenia is it? What do you think, doctor? It is what kind of myasthenia? Whenever it is involving the oropharyngeal or the bulbar musculature? It is called myasthenic crisis.
Myasthenic crisis, yes.
So what will be the treatment of myasthenic crisis?
Yes, either plasmapheresis or IVIG.
Yes, doctor.
Pulse steroids.
Yeah, not steroid. It will be plasmapheresis or IVIG. Whenever it is involving the bulbar muscle, it is myasthenic crisis. So we have to do the plasmapheresis. So let's start with your judgment. So Dr. Shushmoy, are you there, doctor?
Yes.
So Dr. Shushmoy from RCP will give the judgment. This is a case of dysphagia. So based on Dr. Biplov's performance, what will be your judgment in physical examination?
I think he covers all the things.
Okay.
He didn't mention about the bedside spirometry, but he
mentioned
the
single
breath
breath
count. Yeah.
Yes. Anything else, doctor?
I know he did the ceiling test and
He did
chicken
it.
test.
He did
all
it.
the things he did, I think, is satisfactory.
But did he check the bulbar weakness?
No.
It is a big mistake, doctor. Because this is a case of neurological dysphagia, oropharyngeal dysphagia. So we have to look for movement of that oropharynx. Are you getting it, Dr. Biplov?
Yes, sir.
So this thing was missed. I think you have got the sequence of examination of myasthenia gravis because it is a big examination. So we have to be more focused. Like unless it will be very much difficult to cover all the examination sequences. Let me open the examination sequences. Where is that? Okay, let me find it. I think it's in the drive. Yeah. Yes. So I suggest to memorize all the examination sequences like this. Start with selling test, Dr. Biplov. It is wonderful that you started with doing general examination. but better to start with ceiling test, because myasthenia gravis, in myasthenia gravis patient, you have to do a lot of examination. So you have mentioned that you will check the chest movement and auscultation. Truly speaking, in real exam, you will not get time to go for all the things. So better to be focused, like first doing the ceiling test, then checking the frontal wrinkling, which will be there in case of myasthenia crisis or in myasthenia gravis, if the patient is not treated. Then whenever there is drooping of eyelid, raise the eyelid and look at the pupil, because I'm seeing it from a feedback from the Nepal. I saw that the candidate checked the eyelid and look at the pupil. That's why he got the mark. Whenever you are finding any droopy eyelids at the PACES exam, please raise the eyelid and look at the pupil, whether it is constricted or dilated. Are you getting it, Dr. Biplov?
Yes, sir.
Then check the edge movement. You have to give the instruction that fix your eyes, follow my finger, look at my finger, follow me and tell me when you say double. Then check the muscles of the face, like eyelid muscle, face muscle. Just like telling, close your eyes tightly, don't let me open it. Puff your face, don't let me puff it out. And tell her to give a smile, looking for the myasthenic snap. Then giving whistling and opening your mouth and say ah. And you have to check the neck flexor and extensor, which you didn't check. Also, but if it's a negligible examination, you can skip that, but better to look up for that. Then you have to check for chest scar mark, which can be there sometimes, especially at the UK centers. Then you can start with hand examination, checking the proximal weakness. Then you can do the chicken wing test. Chicken wing test is basically the fatiguability test of the arm, nothing else. Then also you have to check the distal weakness. You have to prove that there is no distal weakness. And you have to examine the charts, because charts will less likely be affected in myasthenia gravis. So you have to prove that. And sensation will be intact. So to prove it all, you have to check the sensation. Did you get it, doctor?
Yes, sir. Yes.
Okay.
So time is very important in this.
Yes, doctor. Timing is very much important.
Yeah.
Unless you become organized beforehand, like this way, it is very much difficult to perform the exam. This is a very much common case and very easy case. But at the same time, if you don't make it prepared beforehand, it is difficult to perform the exam. You may become standstill, that what to do next, what to do next. So one of the doctor mentioned what is chicken wing test. Actually, chicken wing test means first you have to check for proximal weakness. Then you have to tell the patient that move your arm and count from 1 to 20. Then again check the proximal weakness and compare weakness of the both of the arm. The side of the arm which has done this movement will become more weak than the other side. It is called the chicken wing test. It is a local name. Did you get your answer, doctor?
Yes, doctor. Thank you.
Okay. So let's get back. So this will be borderline, doctor. Then, Dr. Shushmay, what will be the mark in identifying physical signs?
Physical science, we also got every science, right?
Yeah, he got all the signs in a perfect way. Because in the real exam, there will be no true bulbar weakness. So what will be judgment, Dr. Shushmay?
So it could be satisfactory.
It will be satisfactory. Then clinical judgment?
Clinical judgment.
Yes.
So in that case, he mentioned that to give the seeds of water.
Yeah, that will go against the welfare, because this can provoke the coughing. Anything else, doctor?
Communication, he mentioned to stop the antibiotics and driving.
Yeah.
So
Yeah.
he also other differential diagnosis, but did he ask about the diabetes, like polyuria, polydipsia?
It can be skipped, doctor. Actually, that will be too much. It can be skipped, but there are some fundamental part of the history taking that I think he missed. Can you pinpoint that? Regarding the family history, he asked close question. He asked that any similar symptoms in the family. Are you getting it, Dr. Biplab?
Yes, sir.
So you asked any similar symptoms in the family. It become close question. Better you should ask any problem in the family. Because you can start with any similar problem in the family, then you can progress with any other problem in the family. Because there was a positive family history of mother having rheumatoid arthritis, which is not this kind of swallowing difficulty. So whenever you are going to ask any similar problem in the family, the surrogate will become focused. He will not give you the exact information that the mother also had rheumatoid arthritis. So never go for any close question. Even if you ask any close question, later on expand it in asking the broad question, like any other family problems that I should be aware of. Did you get it, Dr. Biplab?
Yes, sir. Yes, sir.
Anything else you can mention, Dr. Sushma?
Not really.
Okay. Did you ask the medication allergy?
No, I didn't
No,
notice
sir.
that.
I didn't ask.
Yes, doctor. Actually, in this course, I repeatedly give training to ask this question because you cannot think whenever this will come out. Suddenly, this can pop up. So try to make a practice of asking this medication allergy. It is for your betterment. I think he told to stop the driving, Dr. Sushma.
Yeah, he did. He did.
Okay. So based on this, what will be your judgment?
So it could be borderline.
Yeah, it will be borderline. So there's a question, sir, please repeat, do we have to do the AA test and offer water or not? Actually, doctor, in case of neurological dysphagia, the patient will have problem in swallowing. And whenever you will offer some fluid to him or her, he will begin to choke. He will begin to cough. So that will go against the welfare. That is why don't go for that. Usually they don't give the true neurological dysphagia, but they will give the true myasthenia gravis patient. But if you offer water, that can have a chance of provoking the cough. And if anytime the patient is in any kind of distress that is caused by you, you will automatically lose mark in the welfare. So better not to take this kind of risk. Did you get your answer, doctor? Okay, so Dr. Sushmai, what will be judgment in differential diagnosis?
Differential diagnosis is satisfactory.
Yes, it is satisfactory. Clinical judgment?
It is also satisfactory.
But I would like to add one thing. Did Dr. Biplab mention in the investigation that apart from basic investigation, he mentioned all the wonderful investigation?
No, sir. Apart from basic,
Yes,
I didn't
doctor.
say.
This is the simple thing. Candidates make mistake. And you are saying, whenever you are practicing, you are missing this simple thing. You know a lot of things, doctor. But actually, in the real PACES exam, candidates miss the pass mark for making simple mistake, not a grave mistakes. That is why you have to practice repeatedly with all your partners. Never go for any investigation unless saying apart from basic investigation. Did you get it, Dr. Biplab?
Yes, sir. Yes.
Okay. So, Dr. Sushma, what will be the judgment then?
It is satisfactory. You mentioned the IVIG and plasma results.
But truly speaking, in the PACES exam, if he misses to mention the basic investigation, mark would be cut. This is true. Because they want a simple approach first. They are not assessing you as a consultant there. This is true. This MRCP PACES exam is not a consultant level exam. This is a register level exam. We are not being judged as a junior doctor, not as a senior doctor. We are being judged as a middle level ground. So this simple mistake has to be corrected. So she will be affect the mark. And I will suggest this will be borderline, doctor.
Okay.
Then managing patient consent. Dr. Sushma?
He made all the concern, right?
Yes. So what will be the judgment?
So it will be satisfactory.
Yes. And welfare is also satisfactory. Better not to offer the water in this case, in case of oropharyngeal dysphagia. So based on this, if we calculate all the marks from one examiner, what will be the total mark for each exam from each examiner? Dr. Shushma? Dr. Shushma?
It will be 10? No, it will be 8.
It will be 11, doctor. Like, there are 4 satisfactory. So, satisfactory means 2 mark. 4 into 2 is only 8, 3 borderline. So, 8 plus 3 is equal to 11.
Okay.
If we have to multiply it into 2, because marks will be calculated from both the examiner. So, it will be 22 out of 28. And this is the way how you should practice with each other. And the more you will practice, the more you will become like an examiner, and it will be easier for you to perform as an examiner, truly speaking. Because whenever you will know that the examiner is wanting these things from me, then you can perform in well manner. That is the reason every day I poke you that do practice with each other. So Dr. Shabab, you raised your hand. Do you have any question?
Yes.
Yes.
Thanks for such nice performance, both of you doctors. I have a question regarding the management of myasthenia gravis. So,
Yes.
in a video, you said, in case of myasthenia crisis, I would like to give a call to ICU for any mechanical ventilation, then
Yes.
start the pyridostigmine. If no response, with consultation with the neurologist, I will go for steroid. So if the patient is in myasthenic crisis,
No, doctor, it will be wrong. In myasthenic crisis, it will be plasmapheresis, not pyridostigmine. If it was that,
okay.
Are you getting it, doctor?
Yes, so at that time I have to say, like, with consultation with the neurologist, I will go for IVIG or plasmapheresis.
And I will make a call to the ICU because this patient is in myasthenic crisis. He may go to anytime respiratory failure. So we have to make a contact to the ICU.
Okay. Okay, fine. Thank you.
Okay. So Dr. Biplop, do you have any question here, doctor?
No, sir. No, sir.
Doctor,
I
don't
think
be disheartened because
no, sir. I think you are absolutely correct, sir. When we see our mark sheets, now are cutting marks for correctly anything. We never imagined that they might have thought in that way. So
yes,
this is
doctor, they
absolutely
cut
correct.
them up for simple things. And the more
Yes.
you will practice in this way, like you have to carry this mark sheet with you all the time. You can carry it with your at your iPad, or you can print it out and do practice with your some partner. But if you practice in this way, giving mark and taking mark, then you will think that you will not need anyone's help.
Yes.
So right now, Dr. Biplop's job will be to contact with Dr. Shushmoy, and Dr. Shushmoy has to contact with Dr. Biplop from now on. And every day, you both 2 doctors have to practice with each other and report me. Will you do that for me, doctors?
Yes. Yes, doctor.
Yes, sir. Yes. Yes.
Wonderful. Thank you, doctor. Thank you very much.
Thank you. Thank you.
You are most welcome, doctor. So let's proceed to the next pair of candidate. Let me see who is there. The list. So, Dr. Farah, are you there, doctor?
Yes.
Okay. Then let me put doctor. Dr. Rahul, are you there, doctor?
Yes, sure, I'm there.
Okay. So right now, Dr. Farah will be the examinee and Dr. Rahul will be the examiner. I will be just a surrogate. So let me pick up a case for Dr. Farah. So, Dr. Farah, this is your case.
Yeah, okay, can I get 2 minutes?
Yes, doctor, you will get it. So there is a question in the group, how to take preparation for PACES. So doctor, actually, this course is only for long clinical consultation. This is not for covering all the short case station and the communication. So if you need some advice, you can knock me later on at the WhatsApp group. I will try to meet your concern.
Okay, so can I start?
Okay. Just a minute. Yeah, you can start, doctor.
Hello, ma'am. Good evening. This is Dr. Farooq, a doctor in this clinic today. May I confirm I'm talking to Mrs. Muttaq, a 40-year-old?
Yes, doctor. I'm Mrs. Muhtar. I'm 40 years old.
Okay, so are you comfortable with us discussing your health problems in today?
Yes, doctor. I am comfortable.
Okay, so now can you please you tell me what brings you in here today?
Doctor, I'm having some pain at my tummy for the last 3 days, doctor. It is quite really distressing, doctor. Please help me.
Okay, yes, Mrs. Muttaq, I can see that this problem is this is really causing problem for you. After our consultation, I would arrange to get some painkillers for you so that it goes away. How does that sound?
That will be very much helpful, doctor. Thanks for
Okay.
that.
Okay. Okay. So now, about the pain, can you please tell me at exactly the what place you are having this pain?
Patient is showing the left lumbar region. I'm feeling pain here, doctor. Left lumbar region.
Okay. Okay. So did it started occurring all on a sudden or came in gradually?
Doctor, I noticed it suddenly, doctor.
Okay. Now it's increasing, going away.
Yeah, no,
Increasing
doctor.
or going away?
It is increasing day by day, doctor. For the last 3 days, it has become like unbearable.
Okay. And there was no pain-free period in between, right?
No, doctor. Before 3 days, I was completely fine.
Oh, okay. So this pain, is it goes anywhere from that?
No, doctor.
Okay. So anything that makes you feel more painful?
I have not noticed, doctor.
Okay. So anything makes it a bit relieved?
No, doctor.
Okay. So if I ask you to grade this pain between 1 to 10, will it stand?
It is, doctor, 6 out of 10.
Okay. I can see that it's really problematic for you. Okay.
Yes, it is, doctor.
Okay. Okay. So is it the first time or does it has occurred before also?
No, doctor. This is the first time.
Okay. And so now, along with this, I'm going to ask you some more questions to get a better idea.
Okay, doctor.
Please be with me. Okay. Now,
Okay.
can you please tell me, have you noticed any tummy bloating with it?
No, doctor.
Okay. So do you feel like throwing up?
No, doctor. I'm not feeling. I'm feeling sick, but I have not thrown up.
Okay. Okay. Now, can you please tell me about your waterworks?
Doctor, it is getting problematic, doctor. I feel some problem with my water work.
Okay. So may I know any change in the amount?
Yes, doctor. It has been reduced.
Okay. And for how long?
It's been for the last 3 days, doctor.
Okay. And any change in the color?
No, it has become a high color, doctor.
Okay. So can you please show me the color? Tell me exactly what is the color. Is it like looks like the cola?
No, doctor. It is high color. Not
Okay.
like
Okay.
cola.
Okay. Okay. Now, can you please tell me, have you noticed any blood in it?
No, doctor.
Any frothiness in it?
No, doctor.
Okay. So can you please tell me about your bowel work?
It is normal, doctor.
Okay. Any change in the bowel work habits recently?
No, doctor.
Okay. Any pain with your bowel works?
No, doctor.
Okay. Now coming back to your water works. So do you feel pain while passing your water work?
No, doctor. I don't feel pain passing the water.
Okay. So along with this, do you have any fever?
Yeah, doctor. I'm noticing I'm having fever.
For how long?
For the last 3 days, doctor.
Okay. So may I know the highest recorded temperature?
It was 101 degree Fahrenheit.
Okay. Okay. So I'm going to also give you some meds for that so that the fever gets subsided after
Okay,
our
doctor.
consultation. Aside from that, is this the fever only for these 3 days, or has this fever come in the recent months, recent
No,
3
no,
to
no,
6
doctor.
months?
No, doctor. This is the first time.
Okay, so along with this, have you noticed any change in weight?
No, doctor.
Okay, so do you have any weather preference?
No, doctor.
Any lumps or bumps anywhere in your body?
No, doctor.
Okay. Any rashes over any part of your body?
No, doctor.
Any pain over your joints?
No, doctor.
Okay. Any problem with your eyes?
No, doctor.
Okay. Any grittiness or redness in your eyes?
No, doctor.
Okay. Any soreness over your mouth?
No, doctor.
Okay. So I'm sorry, but from now on, it's going to be a bit private. I'm sorry for all the rude questions.
Okay,
So
doctor.
now, can you please tell me about your periods?
It's regular, doctor. It's normal.
Okay. So are you on any pills?
No, doctor.
So do you have any long-time partner?
Yes, doctor. I have my husband.
Okay. So um, I'm really sorry to ask you this, but any casual contact out of that?
No, doctor.
Okay. So do you have any kids?
Yeah, I have one kid.
Okay. And I'm again sorry for this question, but have you ever lost any kid?
No, doctor.
Okay. So any condition you had in the past that I should know?
Yes, doctor. I have diabetes, doctor. I have high blood sugar. And I'm
Okay.
taking
Any high
treatment
blood?
for that.
Okay. And any high blood pressure?
No, doctor. Only high blood sugar.
Okay. Any high blood level of cholesterol?
No, doctor.
Any other known diagnosis?
No, doctor.
Okay. So any condition that runs in our family that I should know about?
My mother also used to have this high blood sugar.
Okay. Any other condition, known condition, a named condition? Anything
No,
that in
doctor.
your family?
No, doctor.
Okay. Okay. So may I know your medication chart?
I'm taking tablet metformin, 500 milligram twice daily, and SGLT2 inhibitor.
Okay. Okay. So I might have to review your medications and stop some of them for the time being. So after our consultation, I'll need to talk to my consultant, and we'll then come up with the new and improvised medication chart for you. Is that okay?
Okay, doctor.
Okay. So aside from these two medications, are you on any regular medications?
No, doctor.
Any over-the-counter meds?
No, doctor.
Okay. Any traditional or herbal meds?
No, doctor.
Any allergy to any meds?
No, doctor.
Okay, so going back to those two medications, has there been any recent change in the dose?
No, doctor.
Any other medication that was stopped?
No, doctor.
Okay, okay. So now, may I know what to do for a living?
Doctor, I'm a housewife.
Okay, so have you ever traveled anywhere recently?
No, doctor.
Okay, so do you drive?
No, doctor. I do not drive.
Okay, so I'm again, if the next question sounds sounds rude for that, I'm sorry. Okay, so do you smoke?
No, doctor. I don't smoke.
Okay, drinking?
I drink sometimes in the weekends with the friends and parties.
Okay, so is that within the social limits?
Yes, it is, doctor.
Okay, so I'm again sorry, but any party medications have you used?
No, doctor.
Any tattooing or piercing that you have got?
No, doctor.
Okay, so now coming back to the problem you have, the diabetes. For how long have you been having that?
For last 5 years.
Okay, that's for last 5 years. Okay,
Yes.
so So have you been regular to your diabetic clinic?
Yes, doctor. I'm quite compliant.
And your eyes and okay, and your eyes and your foot clinic?
Yes, doctor.
Okay. Now, do you feel any tingling or sensation over your feet, or you feel like you walk on a cotton wool?
No, doctor.
Okay. Any problem with the vision?
No, doctor.
Okay. So, do you feel it difficult to stand up from sitting?
No, doctor.
Feel dizzy while standing up?
No, doctor.
Okay. Any chest pain?
No, doctor.
Yeah. Okay.
2 minutes left,
Okay.
doctor.
Now, okay. No, I'm going to examine you. At the same time, I'm going to talk to you. Okay. So, I need
Okay.
to check the anemia.
Absent.
Okay. I need to look at the tongue for any dehydration.
Absent, doctor.
I need to know the vitals, including the postural drop.
Postural drop is present. Vitals, temperature is high, as given outside.
Okay. Okay. And now coming to the abdomen. At first, I want to do a superficial palpation to see if any pain.
Yeah, there is a patient is saying I'm having pain. This is the left side.
So, should I proceed over there?
Proceed with gentle. Proceed gently.
Okay. So now I am going to check the renal angle tenderness.
How to check this?
I will go to the back of this patient. Will put my thumbs. Will put my thumbs at the lumbar area, lumbar 1 and 2 area, lumbar 1 and 2 area, lateral to the spinal muscles, and will press and will ask the patient if she feels any pain. Just let me know.
Yes, doctor. It's painful.
Okay. I'm really sorry for all of this. Okay.
It's okay, doctor.
Okay, now I want to do the bedside urine dipstick test.
Yes, noted, doctor. Noted, doctor.
Okay, now I want to check the leg edema, if there is any leg edema.
Absent.
Okay, so now may I know what's your concern right now?
Doctor, why I'm having this tummy pain?
Okay, so after talking to you and after examining you, I think you have a condition we call the urinary tract infection. Don't bother with the medical term. It is when there is a bug that starts residing within your within your waterworks, and this bugs is causing you to have this fever and also this pain over your tummy.
Okay, doctor. Do I have kidney stone?
Okay. Kidney stone, it can be a possibility, but we will be more sure about it after we run some scans, some photographs, and some blood tests over you.
Do I need
Any more
admission, doctor?
Okay. Yes. At this point, it will be better to keep you admitted and give you some fluids before we can proceed.
Thank you, doctor. Thank you very much.
Okay.
Time is up. So after time is up, what do you have to do? Tell the patient thank you.
Thank the patient. Yes.
Yes.
Thank the patient and
try to put her gown on.
Make him comfortable.
Yes.
Make him more comfortable.
Thank you very much. Thank you very much, ma'am. You have done a wonderful job for me. And let me help you putting on your gown. That's all. So, doctor, do you have any diagnosis or differential diagnosis?
Okay. For this patient, I have some differentials. My first differential for this patient would be acute pyelonephritis, probably due to an ascending UTI from the and for the background cause, I would like to keep the SGLT2 as a cause, and it can also be renal stone.
Okay. So, doctor, what are the positive physical findings?
On the positive physical findings, and this patient has renal angle tenderness, and
okay. Any other
bedside urine dipstick test that I.
No. What are your positive physical findings?
Aside from that, I also got postural drop, which
yes.
I think might be due to the dehydration also, and which can also be due to the diabetic feature of diabetic autonomic neuropathy.
Don't mention extra thing, doctor. Did you got anything from the history whether there is autonomic neuropathy?
Not exactly.
So we all do this mistake. Like in the PACES exam, you don't have to speak much. If you speak much, then you will just dig your own grave. Try to speak less, as much as you can. Like, first of all, this is a patient of 5 years diabetes. So no need at all to check for diabetic complication. Do you think any type 2 diabetic patient having diabetes for 5 years and he is well controlled, will she develop any complication? What to do?
It's unlikely.
Yes. So better to skip it. And from the history, already you have got that there is no complication there. So if you mention that this can be a presentation of diabetic autoimmune neuropathy, you may think that examiner will be impressed that this candidate know a lot, but actually you are digging your own grave. If you utter
Yes,
something
it
wrong,
will go in the judgment.
yes, if you tell something wrong, even if it is not related to this case, even if you utter something wrong, that will just kill your mark. So in the practice, even with one another, try to speak less as much as possible and let the examiner ask you the question. He will ask you again and again unless he gets his answer. But don't just jump and give all the answers at one go. Let him ask the question. Okay. So how would you like to investigate?
At first, I would like to do the I would like to admit the patient and then do the basic management like the airway, breathing, and the circulation.
Doctor,
I would
again,
like to give the patient
investigation.
some fluid.
It is investigation. You are telling management. Again, look at this, doctor. Just be cool. You have to speak less and the thing which have been asked. If you answer the management in the investigation, that will also create a bad impression. Are you getting it, doctor?
Yes.
So just be cool and tell in a slow way. You don't have to be very much fast. Because if you speak in fast, if you will complete giving all the answers in 2 minutes, and the examiner will take you from China to the Australia in this 3 minutes. So don't give the examiner that chance. Speak in slow voice so that you can kill much amount of time. Got it, doctor?
Yes.
Okay. So tell me what investigation you have to do.
At first, I would like to order for the basic blood test, including the full blood count along with the ESR and also the CRP. I would also like to order for any serum creatinine, look at the serum electrolytes, and I would also like to do the basic urine routine and the microscopical examination. I would like to send the urine for culture and sensitivity. And then I would like to also go for any radiological examination, radiological investigations. For that, I would like to order an X-ray, kidney, and the urinary bladder for to look for any stone. And I would
Anything
also
else?
like to go for an ultrasound of the
Yes.
ultrasound of the KUB region to look for the size of the kidney.
Okay, that's wonderful. You can also add, if needed, I would like to check the diabetic control in the form of fasting blood sugar
If we
and HbA1c.
and
Just mention it is not needed, but you can add this. The thing you have mentioned, it is well enough to pass the exam. Then, how will you manage this patient?
Okay, for the general management, I would like to admit the patient, then ensure the airway breathing and the circulation. I would like to give the patient IV fluids to keep the blood
Wonderful.
pressure steady. And
And
then for the specific management, I would like to order start the patient on broad spectrum antibiotic, hold off the SGLT2 and the metformin, both of them, and
anything
will
else? You
keep
have
the RBS on regular RBS on regular check. And I would
okay.
like to go for a broad spectrum antibiotic after I have taken a sample to send to the urine for culture and sensitivity.
Anything else to prove you more professional for performing at the UK at the level of register? You have mentioned admission, then circulation. It is okay. What is next? Education and counseling, forming a
Education and counseling, and forming the multidisciplinary team.
Yes, and only for not mentioning this multidisciplinary team, your mark will be cut. This is very much simple, but they prefer this multidisciplinary team a lot. They don't want that you will know all the things. They want this multidisciplinary approach. So you may know a lot, like what antibiotic have to start, how to manage the blood sugar in the during hospital stay, but they are not going to judge in that way. They will assess whether you are safe doctor or not. Are you getting it, Dr. Farah? Did you
Yes.
get the loophole here? How you have to practice now?
Yes, sir.
Okay, so let's start giving the judgment. So Dr. Rahul, are you there, doctor?
Yes, sir.
So this is our case. It was a case of tummy pain. So one of the doctor asked, what are the indication of admission? Actually, any acute patient who is having any vital abnormality, we have to admit this. Dr. Farah has wonderfully asked, I want to know the vitals. In the vitals, I have mentioned that she is having high-grade temperature. Also, she is having postural drop. So that is the indication of getting admitted. And in the PACES exam, one case will be acute, that has to be admitted, and another will be stable. This will be same for all the doctors for the LCC. So Dr. Rahul, based on Dr. Farah's performance, what will be your judgment in physical examination?
Already stopped.
I think it's very satisfactory. I think
Satisfactory. Yes, doctor, it is satisfactory because she has done wonderfully all the needed physical examination. Then identifying physical signs, what will be your judgment, doctor?
She required some prompting, and there was some discussion about whether the diabetes is chronic or not. I don't think that she'd be penalized for that.
Sorry, doctor, your voice is a little bit breaking, doctor. I did not get it. Can you repeat it again?
Yes, sir. I said that Yes, sir. I said that she required some prompting, and there was some discussion about whether to check for complications of diabetes in a patient who has diabetes since the past 5 years and is on regular medications. But I don't think that she will be penalized for that.
Yeah, that will be counted for the clinical communication skill. Like she has taken history of diabetes in long term. That will be counted for the clinical communication skill. But in the identifying physical signs, you have to mention whatever physical signs she has got, whether this is positive or negative. And particularly, you have to be careful about whether she has synthesized any findings or not. There was positive renal angle tenderness, it is truth, and there was postural drop. Dr. Farah has wonderfully identified them. Did you got anything else, Dr. Rahul?
No, sir.
So actually, in the real exam, this will be a dummy case. And the patient will be instructed that whenever the candidate is going to place you there, you have to mention that I'm feeling pain. So the positive signs will be only the pain, and whenever she's going to offer postural drop, it will be there. So these are only two positive physical findings. Nothing else are there here. You will not get any edema. You will not get any dehydration. No real dehydrated patient will ever be given in the PACES exam. This will go against the welfare. Are you getting it, Dr. Rahul?
Yes, sir.
So based on this, what will be your judgment for performance in identifying physical signs of Dr. Farah?
Satisfactory.
It will be satisfactory, doctor. Now let's come to the bigger part. That is the biggest part, clinical communication skill. Now tell me, you have mentioned that Dr. Farah did not ask the duration of diabetes. Dr. Farah, did you ask it? Dr. Farah, are you there?
Yes, I asked for how long have you been having this?
No, doctor, I did not hear it. Dr. Rahul, did you hear it? Dr. Farah did not.
You prompted it.
Yes, I prompted it later on, but I have written it that Dr. Farah did not ask the duration of diabetes. It has to be asked. Dr. Farah has taken a lots of questions, but some important things were missed. Like she forgot to ask about the nature of the pain. Did you ask it, Dr. Farah?
No.
So you have asked a lot of systemic questions that is actually not needed. So nature of the pain was not asked. Then did you ask about the urinary complaints? like burning sensation, micturition,
No,
frequency. That
no,
is
this
very
was
much
missed.
essential for this case because it was ascending infection from the urinary tract. Are you getting it, Dr. Rahul?
Yes, sir. So she asked about the frequency of micturition, but you said that the urine had reduced. And then she asked for like bowel habits, and then she went
Yes.
back to the urinary symptoms.
Yes, but she did not ask the burning micturition. My suggestion is that after doing the ODPARA, better complete the PDF Sajid. Then again, if you get time, come back to the systemic question so that you will not miss any important part. Because if you miss any important part of the PDF Sajid and 5P for this case, mark will be cut for sure. And in the diabetes, she did not ask the duration. Another thing I will add, which will not affect the mark, that is family history. It is only for proving you smart. Like I have told that my mother also used to have diabetes. So what question should I ask later on? What do you think, Dr. Rahul? Anyone is telling that my mother used to have diabetes, my mother used to have this problem. What question should you ask to show some sympathy or something like that? What do you think, Dr. Rahul?
So how is she doing right now? Is she doing
Exactly,
regular
doctor.
with her
Exactly,
medication?
doctor. Yes. How is she doing right now? Did you get it, Dr. Farah?
Yes, Bhaiya.
Yes. Whenever anyone is telling you about any complaint of the family, like my father, my mother, they're suffering from, they used to suffer this problem. The next question should be, how is she doing right now? She may die, or she may doing well with the medication. This will not affect your mark, but this will prove your smartness to the examiner. All these things will get fixed if you do repeated practice. Because I'm not saying it only for giving the only for to console you, because I have seen a lot of candidates that starting with 8 and getting 28. So based on this, did you identify any other things, Dr. Rahul, in the clinical communication skill, like how Dr. Farah took the history? Did he miss any important part?
I had a few questions about,
Sure, doctor.
if we want to know the recent control of diabetes, should we be asking
Yes.
about appetite? Should we be asking about, whether the patient has any blurring of vision? Should we be
No,
asking about,
no, doctor. In the first session, I have discussed that for type 2 diabetes, it has to be there for at least 10 years. With non-compliance to the medication, diet, or something like that. And for type 1 diabetes, it has to be at least 5 years. You may be given a case of type 2 diabetes with 3 years. And it is very much less likely that she will develop any complication at this age. So why to spoil my time taking history for this? Because there are lots of questions for diabetic complication. You have got that PDF. You can see that microvascular complication, autonomy complication, then checking the compliance, the triple D, diet, drug, daily exercise. So no need to go for that if it is less than 5 years. Did you get your answer, Dr. Rahul?
whether she has had any such symptoms in the past,
It is actually
or any
not.
hospitalization is what I was thinking of, because whether she had any DKA in the past.
That will be covered in the past medical history, doctor. In the past medical history, if you look at the flow PDF, it is written there, any recent hospital admission, any hospitalization report, that will be covered there. But any diabetes having less than 5 years, it's not needed to go in details. Just you can ask that, what about your control? Are you compliant with the medication? Most likely the patient is going to tell you that, yes, I am compliant. Because the diabetic complications are given more than 10 years, usually in the PACES exam. Like you may be given a Charcot's joint, the prompt will be leg swelling. You may be given a case of like tingling and numbness of the hands and feet, and that will be more than 10 years, like more than 15 years. Did you get it, Dr. Rahul?
Yes, sir.
So one of the doctors asked that what duration we have to consider for checking the complication of diabetes. Actually, these are the complications of diabetes. These are already provided as PDF sheet. it has to be asked for type 1 diabetes for at least more than 5 years. For type 2, it has to be there for at least more than 10 years. Then you can expect for some complication. And in the PACES exam, the cases of diabetic complications are given whenever on the basis of this duration. Mostly it will be more than 10 years, mostly. Like 15 years, 20 years, something like that. At that case, you have to ask these questions all by one. And there are lots of questions to ask. Unless you memorize it beforehand, it is difficult to perform the exam. So, based on this, what will be your judgment, Dr. Rahul, for clinical communication skill?
Borderline.
Yes, it will be borderline. Then differential diagnosis. Dr. Rahul?
So I was just looking for 3 differential diagnoses. I'm not sure whether she gave them, but I think
it is not necessary.
UTI, she said
it is not necessary. Sometimes you can get only one DD. It can happen for certain cases. In the right lumbar region, if you look for a lot of cases, like there is only kidney and the colon, there is no bowel complaint. So you cannot keep any bowel cause there. Only kidney causes are there. So for this case, we can skip the concept that we have to give 3DD. Did you get it, Dr. Rahul? Any question from you, sir?
Yes, sir.
So what will be a judgment in clinical differential diagnosis?
In that case, it will be satisfactory.
Yeah, it will be satisfactory. Then clinical judgment?
So she was willing to admit the patient, and I think her investigations and management plan, I think I was in agreement with.
Sorry, you agree with her?
Yes, sir. Although she required some prompting, but mostly
yes,
I agreed with it.
She knows all the things. Only thing is that she did not mention the MDT, which I had to prompt. And sometimes in the exam, they don't like prompting. And multidisciplinary team is a must for passing the PACES exam. Whatever station you face with, always go for multidisciplinary team. Got it, Dr. Farah?
Yes.
So to make Dr. Farah corrected so that she never forget to this multidisciplinary team in the lifetime, I will suggest to cut mark here and give her borderline. Did you get it, Dr. Rahul?
Yes, sir.
Okay. Then managing patient consent, what will be judgment?
Satisfactory.
Yes, it is satisfactory, and also the welfare. So based on this, what will be the total mark from each examiner out of 14, Dr. Rahul?
12.
Yes, it will be 12. So if we calculate from both the examiner, it is 24 out of 28. Sometimes marking differs from both the examiners. And it has happened for many times that one of the examiner gave satisfactory, another one not borderline, even unsatisfactory. This can happen because marking differs from person to person. Sometimes, not all the time. So Dr. Farah, do you have any question from this prompt or this marking system?
No, it's okay.
So you have to practice now. You know a lot. Right now you have to practice to speak less. So right now, I will give a case to Dr. Rahul. Dr. Rahul will be the examiner right now, and Dr. Farah will be the examiner.
Hello?
Yes, doctor.
Sorry, I just want to say some comment about bionephritis. It is a good to, I need to ask about if she is passing gravels before or stone, and ask about the uremic symptoms like buffness in the face, confusion,
He
tremor.
has asked it.
Oh, no, asking?
She asked about the feeling sick, throwing up. Features of uremia she has asked. She asked whether there is any legs. She examined during physical examination, but she did not ask about the gravels passing through the urine. Yes, she missed about that part.
Yes, thank you.
Yes, doctor. So, Dr. Rahul, this is your case.
Yes, sir.
Are you seeing? Okay. You have 2 minutes in time. If you are prepared beforehand, just let me know. We can start then. Dr. Bharat has asked temperature examination. Can we? Yes, doctor. In the exam, we have to ask for checking the temperature, but we don't have to measure the temperature. We just have to tell that I want to know the temperature of this gentleman. Better to ask, I want to know the vitals of this gentleman in the form of pulse, temperature, respiratory rate, oxygen saturation. Because in the UK, what happens, the nurses actually measure this and they keep it up to date. Yes, doctor, radiation has to be asked must. In the mnemonic we discussed, radiation is already there. That is called OD para. Actually, all the things that make some problem in the PACES exam for long clinical consultation, this can be corrected easily by doing repeated practice. This is not a very much difficult exam to pass. This is a very much doable exam. And the more you practice, the more you become perfect. And it is not needed that you have to practice with any mentor all the time. If you can build some good partnership, this exam is very much doable exam. And this is a completely myth that long clinical consultation is very much difficult. This is a complete myth. Dr. Rahul, are you ready, doctor?
Yes, sir.
Okay. Dr. Farah, are you there? Dr. Farah, are you there, doctor?
Yes, I'm here.
Okay, so keep an eye on Dr. Rahul's performance and you have to give the judgment. So, Dr. Rahul, let's start.
Hi, my name is good evening. My name is Dr. Rahul. I'm the patient candidate today. Can you confirm that you are Mr. Clark and that you're 25 years old?
Yes, doctor. I'm Mr. Clark. I'm 25 years old.
So, Mr. Clark, what brings you here today?
Doctor, actually, from today's morning, I'm having repeated episodes of blood vomiting. I never had such episode in my lifetime. So I'm really very much frightened, doctor. Please help
Thank
me,
you for
doctor.
that information. You said that you're having repeated episodes of vomiting since morning today. You have never had
Yes.
them earlier. Okay.
Yes, doctor.
So are you having any retching along with that? Do you feel like, have you been vomiting, or is it like, for doing the
Doctor,
vomiting,
it
have
is
you been using any
just blood
force or
came out.
pressure?
Doctor, it is
It
just
just
blood
came
coming
out.
through my mouth.
Right. So was there anything that you did prior to the vomiting that might have caused it?
No, doctor.
Okay, thank you for the information. So are you having any other symptoms apart from that? Are you
Like,
having any pain? Are you having any tummy pain?
yes, doctor, I'm feeling some pain at my tummy.
Can you show me where you're feeling the pain?
At the right up, at the upper tummy.
Have you felt this earlier too?
No, doctor, this is the first time I'm feeling this pain.
Is this so?
Doctor, your voice is breaking.
Is this pain going to the back also?
No, doctor. It just stays there.
Thank you for the information. Are you feeling dizzy also?
Yes, doctor. I'm feeling dizzy, doctor.
Thank you for the information. So, are you on any medications, Mr. Clark?
Yes, doctor. I'm taking medication for some joint pain, doctor. Actually, I played some football recently and I got hurt myself. That's why I'm taking the pain medication, doctor. Nothing else is there.
I have noted that you're taking pain medications. Are you taking any medications along with the pain medication, which might have been given to prevent any side,
No, doctor.
prevent, them from
No,
having
doctor.
any complications, causing any
No, doctor.
complications?
No.
Okay.
No, doctor.
Okay. Thank you for the information. So, what have anything else that you want to tell me about?
Like, what do you want to know?
I want to ask you about whether you're having any jaundice, or whether you're having any yellowish discoloration of the eyes.
No, doctor.
Are you having any yellowish discoloration of the urine?
No, doctor. No, doctor.
What about your? You said that you've been vomiting. So
Yeah.
I can understand that your oral intake might have been reduced and that you're feeling dizzy also.
Yes, doctor.
Have you how much have you taken since morning?
Sorry, doctor. Your voice is breaking
What has your
again.
urine output been since morning? What is your urine output? What is your water works been since morning?
Actually, doctor, from today's morning, I have not gone to the washroom yet.
Okay. Are you having any headache?
No, doctor.
Are you having any difficulty in breathing?
No, doctor.
Okay. You said that you're feeling sick. So
I'm not feeling sick, doctor. Actually, I'm feeling pain and suddenly this blood came out through my mouth, doctor.
I can understand your concern and we'll see what we can do about that. So,
Okay, doctor.
this has never happened to you earlier, isn't it?
No, doctor. This is the first time. That's why I'm very much frightened, doctor. What is happening with me?
Okay. I can understand your concerns. So, can you tell me something about any other? Are you apart from the medications that you took about the pain? Are you taking any other medication?
No, doctor.
Do you have any long-term conditions that I need to be aware of?
No, doctor. I was perfectly all right.
Hello?
Doctor, I was perfectly all right. I don't have any other issue.
Okay. Has this happened in your I'll just ask some personal questions now. Do you
Sure,
have
doctor.
any what work do you do?
Doctor, I'm a student, doctor.
Okay. And would you say that you've been under some stress? Has there been any exam or has there been anything that has kept you busy in the past few days?
No, doctor. I don't have any kind of stress,
Anything
doctor.
that has been a source of stress for you?
No, doctor.
Okay, thank you for confirming that.
Okay.
So, apart from that,
Hello.
yeah, I'm there. Can you tell me something about your water works and your bowel works?
Doctor, from today morning, I have not gone to the washroom yet, doctor. And my
Fine,
bowel
I noted.
work was
Thank you.
okay, doctor.
Thank you for confirming that again. And
I have not passed any urine since today morning, doctor.
I can understand your concern, and we will see what we can do about it. So, Who's is there anything else that you want to add apart from whatever that I've asked you?
What do you want to know, doctor?
Do you take any alcohol?
Yes, doctor. I drink socially, doctor. Sometimes at the
Would you
weekend.
say that your
with my-
alcohol intake has increased over the past few days?
No, doctor. It is within social limit, doctor.
Thank you for confirming that. What about your, do you smoke?
Yes, doctor. I smoke.
And how many cigarettes do you smoke a day?
I usually smoke 10 cigarettes a day.
Since how many days have you been smoking it?
I'm here doing this for the last 5 years, doctor.
Okay, I think we need to cut down on your smoking habit, and we'll help you with that.
Okay,
What
doctor.
about, are you married? There's some personal questions that I need to ask you. Are you married?
No, doctor. I have my girlfriend.
And that means, are you sexually active? If you don't mind me telling, if you don't mind telling me that.
Yes, doctor. I am.
Okay, and you have one constant partner, isn't it?
Yes, doctor.
Have you been taking any drugs? Have you been taking any drugs to your blood channels?
No, doctor.
Any drugs? Sorry for being so upfront. This. And
No, doctor.
okay, thank you for confirming that. What about your appetite and what about your diet? Okay, you
It
told
is
me that you've
normal,
not
doctor.
taken anything since morning. Thank you.
Normal,
Okay,
doctor.
it's been normal otherwise. Okay, thank you for confirming
Yes.
that. Does anybody in your family have any similar complaints?
No, doctor.
Does anybody in your family have any complaints that I should be aware of?
No, doctor.
Any long-term diseases,
No, doctor.
chronic diseases? Are you allergic to any drug?
No, doctor.
Thank you for confirming that. Okay, so have you undergone any surgery in the past? Any surgery in the
No,
recent
doctor.
past?
No, doctor.
Okay, thank you. So can I examine you now?
Sure, doctor. What do you want to say?
So is the patient pale?
No. How? Whenever you are going to check the anemia, it is
Can I keep anemia? Yeah, I want to check for anemia. I
absent,
want to
doctor.
check for the pulse. I want to check for the volume of pulse. I want to check for
Normal.
dehydration.
Absent. How to check the dehydration?
I want to see the tongue for dehydration. If I want to check the capillary refill time, I'll do that.
Absent. All are normal. 2 minutes left, doctor.
Okay. And the patient is not. Do you have, Mr. Clark? Can you tell me some? Does the patient have any? I'll do the tummy examination. Does the patient have any pain?
Yes, patient is
superficial
showing.
abdominal palpation?
Yeah, the patient is showing I'm having pain at this upper tummy, epigastric region.
Right. Does the patient have any postural drop? In blood pressure?
Present, doctor.
Thank you. And the patient has pain in the upper tummy, and so I'm not going to do palpation. Does the patient have any hepatomegaly?
Absent, doctor.
Does the patient have any pedal edema?
Absent.
Tachycardia?
On the palpation, whenever you were checking the pulse, there is no tachycardia.
And the pulse is low volume, or is it steady? Is it steady low volume?
Normal, doctor.
Does he have any accelerated breathing? Is he breathing fast?
No. He's completely normal, looking at you and laughing.
Okay. And do you have any concerns, Mr. Clark?
Doctor, why I'm having this blood vomiting?
Mr. Clark, as you told me that you had some pain for which you had some injury a few days back because of some pain medication. So I think this pain medication that you have taken, it is causing some injury it has caused some injury in your stomach. Usually with that pain medication, with some other drug also, which you might not have taken. So we will rectify that, and we'll have to admit you for observation first. Any other concern?
Doctor, do I need admission?
Yes, Mr. Clark, you require admission.
Oh, okay. So, doctor, is it cancer?
Mr. Clark, I'm sorry, I didn't ask you earlier. Is there a family history of cancer in your patient? In your family, is there a family history?
No, doctor.
Fine. Then I can reassure you that right now I can tell you that we don't see that there is any. I need to investigate that further. I will talk to you further, and then we'll find out. And if there is any right now, but we right now I don't see any symptoms. You have, but if I'm sorry, I think that there is no indication right now of the cancer, but we need to evaluate you further. And if we find something like that, we will keep you informed. If your
Okay,
investigations or
doctor.
if your reports tell us something
Time's up,
about that,
doctor.
we'll keep you informed.
Okay, doctor. Time's up. So, doctor,
Thank you for your time.
do you have any diagnosis or differential diagnosis?
In differential diagnosis, I want to consider peptic ulcer disease, which is secondary to the gastritis that the patient might have had because of the NSAID. So there could be NSAID-induced gastric injury.
Okay. Do you have any other differentials?
I would
Any other causes of upper GIT bleeding? You can mention. Also mention the points
I would
going
want to
against.
consider. I would want to consider Mallory-Weiss syndrome, and I would also want to consider.
Doctor, anytime you have mentioning any DD that does not go with this, you have to also tell why it does not goes for this. Like you have mentioned Mallory-Weiss here, that will start after repeated vomiting. So you have to mention that like this.
He did not say
against
that. He did not say that.
Yeah. So my secondary is Mallory-Weiss, but against that patient or the young boy did not complain of any repeated blenching or something like that. Did you get it, doctor?
Yes, sir.
Anything else you want to mention? Any other
And I
TD?
would also want to include alcohol-related gastritis. Though he says that he's been drinking within social limits, but I would want to consider alcohol also as a source of gastric injury.
Okay. Okay. So what are the positive physical findings, doctor?
He had postural drop, and he also had postural fail, and he had postural drop, and he had tenderness in
Okay. What
in the
can you repeat
epigastrium.
again, doctor? He has postural drop.
He was pale, he had postural drop, and he had tenderness in the epigastrium.
Okay. Okay, doctor. So how do you like to manage?
I would want to admit this patient. I would want to use the ATC approach. I want to involve the multidisciplinary team. I want to assess
Doctor,
whether the
not
patient
management.
requires
Doctor, not management. You have to mention the investigation.
investigations. I'm sorry. So the investigations I would want to do apart from the routine investigations. I would want to do I would want to first quantify the amount of hemoglobin. I want to see whether he has severe anemia and whether he requires blood transfusion. I would want to do a grouping and cross matching. I would want to insert grouping and cross matching, and I would want to do his liver function test. I would want to do his serum albumin. I would want to do his PTINR to assess liver function further. I would want to do would want to consider doing an endoscopy so that I can find out whether there is active bleeding. If the endoscopy shows active bleeding, then I would want to do an endoscopic any gap, whether he requires any banding or or binding, or whether he requires any glue.
Okay. So how do you like to manage?
I would want to admit the patient. I would want to follow the ABC approach. I would want to involve the multidisciplinary team. I would want to involve the gastroenterologist and find out whether he requires and plan him for endoscopy. And I also want to insert two Rajpur cannulas, start him on IV fluids, consider proton pump inhibitors, IV proton pump inhibitors, and then if he's and I want to do I would want to also do an EBGT blood acidosis and
No need, doctor. Don't go for the ABG
Yes,
for this case.
Yes, sir.
It is
Yes,
well enough. The thing you have mentioned, you will go for endoscopy. So first starting PPI, that's well enough. Starting RB fluid. ABG is not necessary for this case, doctor. Okay.
I would want to plan his pain management more efficiently so that he gets gastric protection. I would want to change his medications.
Yes. So let's start providing the judgment. So Dr. Farah, are you there?
Yes.
So this is a case of blood vomiting. It was a case of peptic ulcer disease due to painkiller without taking any PPI. So based on Dr. Rahul's performance, what will be your judgment? First, tell me what will be judgment in physical examination.
In the physical examination, he checked the, I would say satisfactory, as he checked the anemia. He also checks the abdomen for any tenderness. He asked for
Yes.
the dehydration and also the postural drop. Just check for the pulse, and
Yes. He checked it.
it's okay,
So it is satisfactory. Then
I'd
come
say.
to the next skill, that is identifying physical signs. What will be your judgment?
Mm,
Just keep in mind,
uh,
this is a dummy case. In the exam,
uh,
this will be 100% dummy case, and this is very much popular case. Now tell me.
yes. Yes, he went through all of the necessary things and got the postural drop, so I'd say satisfactory.
But he mentioned pale. In the introductory session, I discussed this thing actually repeatedly. This will be purely a dummy case. They will just bring a medical student or a doctor there. He will complain you that from today's morning, I'm having 7 to 8 times of blood vomiting. So in our day-to-day clinical practice, from our experience, we expect that the patient will have anemia. But that guy will never have anemia. And they will watch whether you are synthesizing anything to match your diagnosis. And this is the trap. Only by mentioning the pallor, all the marks has been gone in identifying physical signs. And this is a
Yes, in that case,
loophole.
it will go to unsatisfactory.
Yes, doctor.
As because one single sign synthesis will get it to the unsatisfactory.
Yes, doctor. I am happy that Dr. Rahul made this mistake. So he will be careful enough. And Dr. Rahul, in the real exam, they will never give you some real shock patient, like you are expecting straight like pulse, tachycardia. These will never be there. Even sometimes, if some patients feel some uncomfortable feelings there, they will just change the patient and bring another one. So you will not get pallor for this case specifically. Did you get it, Dr. Rahul?
Yes, sir.
And I told it, whenever you asked, is there any pallor? I told it no. And this is a must to do. Just keep it in mind. It will be easily understandable. Whenever you are seeing one patient in the examination, you understand that this is a dummy case. That is why I was telling you that patient will look at you and laughing. I got a case of pulmonary embolism. She was just laughing at me and giving me the answer. Is it really possible in real life, any patient with pulmonary embolism giving history and laughing? So that is the loophole here, and it is a very much important message to every candidate. So this will be unsatisfactory only for saying pallor. And this is how the PACES cases are given. Then in the clinical communication skill, what will be your judgment, Dr. Farah?
In the clinical communication skills, I would like to go borderline, as
Yes, why?
there was something, there was some histories missing, like
Like?
from the blood vomiting. Did he ask about the color?
Yeah. No, he did not mention the color. And it is,
The color and the color and the amount, and also he did not
yes,
and also he did not separated it from the hemoptysis. Like, does it come with vomiting or does it come with a cup?
yes, doctor. Wonderful judgment. Anything else?
Yes, he did not also mention any clots, as the clots will mean that there has been a massive hemorrhage and this will go
Yes,
immediately into the admission.
yes. Actually, the blood is coming from the
All
stomach, so likely it will be like a dark color, or there will be some clots there.
Yes, and he also did not ask for any other bleeding from any other sites, as
Yes,
one important the DD here will be hereditary hemorrhagic telangiectasia. In that case, patient might give a nosebleed or epistaxis history.
yes. Bleeding from any other sites has to be asked. It has to be asked for any bleeding issue. You're right, doctor. Anything else, doctor?
Mm. Uh, Family history. Did he ask about the weight loss?
Yes, he asked about weight loss.
What is the weight loss? Okay. Um, this is all I could get.
Okay, I will add something. He didn't ask the impaction on job and daily life, which is a must to ask question for long clinical
Yes.
consultation.
Oh,
I
yes.
will-
And There's yes, and there's probably another point now that I remember that the patient said he feels dizzy.
Yes. So
And if the patient says he feels dizzy, and if he is driving, the driving must be stopped.
yes, but he didn't ask about driving. Driving was missed.
Yes. Uh, and there is another thing. Did he ask about any binge drinking of alcohol?
Yeah, he asked it.
Okay. Then that's it.
Do you agree with Dr. Farah, Dr. Rahul?
Yes, sir. So I had this in mind and I was noting it down, but it's just because the acute case, I just thought that it will seem out of, that this patient is sick. And so, that is the reason I did not ask it. I had this in mind.
Yes, doctor. It's actually all the things you have in mind, but you have to make it out of your mind. That is why you have to do the practice regularly. You get it, doctor? And in the flowchart, you have been given the written lines like you have to practice saying like this, that I'm here to talk to you about your problem and examine you. Is that okay? If at any point you have any question, please feel free to interrupt me anytime. You have to practice this repeatedly with your partner so that in the exam, just the reflex will come. Because in the exam, if you think and then perform, then inside the mind you will have it, but outside the mind it will not come out. That is the way you have to practice, doctor. And in the GIT, like we have discussed the GIT prompt, all the things has been written there. Yeah, this hematemesis approach, first dysphagia. Yeah, like I suggested that you have to make your notes and keep it memorized. That what was the amount, how many times did you vomit it, what was the color of the blood, was it bright red or dark red, was there any frothiness or mixed with phlegm to differentiate it from the hemoptysis, any bleeding from any other part. Have anyone told you that you are getting pale day by day? Do you feel dizzy standing from the sitting position? So better to memorize these questions beforehand and practice it with one other. Did you get my point, Dr. Rahul?
Yes, sir. Yes, sir.
Okay. So let's complete the mark sheet. So Dr. Farah, what will be your judgment? Another thing is that I want to add, Dr. Rahul, in the exam
Yes,
for
sir.
the PPI, you have to mention like, did you take the tummy protective medication? In the exam, it is called the tummy protective medication. You can ask it directly. Whenever anyone is taking any painkiller medication or any steroid, you can directly ask any history of taking tummy protective medication. For this case, he will never almost every time deny that I forgot to take this tummy protective medication. Did you get my point, doctor?
Yes, sir.
Okay. So based on this, Dr. Farah, what will be your judgment in clinical communication skill?
I'd give a borderline.
But I will suggest it will be unsatisfactory, truly speaking, because Dr. Rahul has to improve repeated
Yes.
practice.
Yes, because the tummy protective medication and the stopping the driving, these two are two vital points.
And also the impaction. Because in the PACES exam, you have to be a safe doctor. You have to ensure the safety of the patient, not only in the hospital. Also, you have to
And
ensure.
also another thing that he has to stop the painkiller medication immediately.
Yes. Stop
Like
taking
I
the painkiller.
stopped the SGLT2.
Yes. He has to
So
tell.
for this, I have to say that I asked about the tummy protective medication, and at the end, I also said that we'll actually make an analgesia plan of analgesia, and we'll give you, adequate analgesia along with protection. I said that at the end.
Okay, doctor. I think I missed it then. I missed it due to some voice breaking or something like that. That is okay. From my side, there will be another suggestion. Whenever in the PACES exam, you are going to some invasive investigation, during meeting consent, give an idea of that. Like for this case, we have to go for endoscopy. Some cases you can go for any renal biopsy or lymph node biopsy. These are invasive procedure. So during meeting consent, give an idea for that because this procedure needs permission. So you can go like this, like after taking his stand, after admitting you, we can go for some procedure called the sniff test. And in this case, it will be camera test. This can be done to you after taking consultation from the gut doctor, after taking your permission. Did you get my point, Dr. Rahul and Dr. Farah?
Yes.
So during
Yes,
meeting consent, whenever you get any invasive procedure, just give an idea for that because permission is needed for that procedure, so that you can prove yourself more professional to the examiner. So I will suggest this will be unsatisfactory because lots of things has to be corrected, and it is easily correctable. You can automatically see if you do regular practice. Then in the differential diagnosis,
I just wanted to ask him about the appropriateness of that. The idea is that when I do the exam, at the back of my mind, when I was thinking about asking impact on job, he'd already mentioned that he was a student. And then I'd also asked him about the fact that whether there had been any stress in his life, and he had said that there had been no other stress. So the idea is that when this patient comes to me and he's like in acute case, should I ask him what is, and this is it's an acute presentation. He just said that this happened for the first time. So when I was thinking about, asking him about impact on the job and daily life, it just felt to me that, it is just out of, like, it is not appropriate to the situation.
You are right, doctor. But what happens in the PACES exam? The examiners have some predilection to hear some particular words from your mouth. You think that you think you're right, but the examiners, like one of the examiners, will sit far away from him. He will just put an ear to your saying and will just make a note that this point has been touched. This point has been touched. They will just see whether you have asked impaction on daily life, you have asked or not. You may think like that, yes, I have asked whether you have any stress. If this problem impacted his daily life, he would certainly have some stress. But truly speaking, in the PACES exam, they don't think in that way. They're not that much philosophical. Did you get my point, doctor? You are right.
Yes.
In practical life. But for passing the PACES exam, you have to follow the rule. Acting like a robot, truly speaking. Sorry to say. So it is better to make a reflex for asking impaction on job and daily life for every case. I mentioned to you that, yes, I'm a student, but if you ask that how this symptom is affecting your job in daily life, it can happen that he has some exam. For this blood vomiting, he cannot attend the exam. So you have to meet that concern. You have to refer him to the respective department. Like he may need some sick leave for that. That is why you have to ask this question for every patient, whether it is acute or whether it's stable. And sometimes it can happen that due to the problem, like in Parkinson's disease, there is repeated fall. Whenever you're asking that how this symptom is affecting your job and daily activity, the patient will give you the information that for this repeated fall, I'm unable to take care of myself. I'm unable to do my daily household activity. For that person, you have to refer him to the occupational health worker. He will come and do the daily household activity for that patient. But for that, you have to refer the patient to that occupational health worker. You have to inform the occupational health worker that this patient needs support. Are you getting me, doctor?
Yes, sir.
Okay. Any other question you have?
So that is it for the time being.
Okay. So, Dr. Farah, what will be judgment in differential diagnosis?
In the differential diagnosis, should it be better to keep cancer as a last DD?
No, doctor. You can keep it, but against that, you have to mention that there is no loss of weight, loss of appetite, and there is no family history of cancer. You can mention all the 5 DD, but at the same time, you have to mention the point that goes against them. Like the first DD is peptic ulcer disease. It can be ruptured esophageal varices, but against that, there is no stigma of CLD from the history and physical examination. This can be malarious tear, but against that, from the history, there is no repeated episode of vomiting before this blood vomiting. This can be cancer, but against that, there is no loss of weight, loss of appetite, and there is no family history of cancer. You can go in this way to cover the DD. Did you get
okay.
it? Yeah.
Yes. So then this would be satisfactory.
Yes, it will be satisfactory. Then in the clinical judgment?
Here I'd like to go for borderline.
Why?
Because of that one thing that he has to stop that he has to stop the driving, and he had to mention about the camera test time in the endoscopy
Actually,
in the concern part.
that will affect the consult part, but actually not for mentioning the endoscopy. like it will not affect the mark actually, because he has mentioned that term endoscopy in the cross questioning.
In my cases, in my previous examinations, I got
Okay.
my mark deducted both in the differential and the judgment.
Okay.
But,
Only for not mentioning endoscopy.
yes, for not the differential was missed, and so the investigations, all whatever I missed, I got marks deducted from that, and these two are where I failed actually.
Did you mention the term endoscopy or not?
Did not none of my cases had endoscopy in it, but about this sort of invasive procedure and others, wherever I missed, I got deducted.
Yeah, that is true. But Dr. Rahul has mentioned that we have to do the endoscopy with the examiner. He mentioned that we'll arrange for endoscopy. We'll go for endoscopy and see whether how the bleeding can be controlled. During cross questioning, he mentioned that part. But it is true that he did not mention it to the patient. Are you getting
And
it?
another thing is yes, and another thing is the driving, and
yeah, he did not
another
mention the
thing is the
driving.
drive, and they did not mention the driving, and it could cost the mark in here.
Yes, actually what happens, some examiner, for not mentioning the driving, cut the mark in clinical communication skill, while some others cut it in the clinical judgment. It is actually based on their preferences. But mark can be cut from both sides for not mentioning driving. And that is why covering the PDF Sajid is a must. Whenever you are entering the exam, in that blank paper sheet, write this PDF Sajid and all the DD, so that you don't miss any important part, because sometimes in the rush of the time, you may forget to ask any important part. So, Dr. Farah, what will be the judgment?
So I'd like to keep it borderline.
Okay, for not stopping the driving. Okay, you are the examiner. You can do for this. Yes, it is true. For not stopping the driving, the mark can be cut both in the clinical communication skill and both in the clinical judgment. It is true. And also, but not for mentioning that he has to go for endoscopy, not for providing this information to the patient. Mostly will not affect the mark. But if he did not mention this to the examiner, then a lot of mark will be cut. Then, Dr. Farah, what will be the judgment in managing patient concern? Dr. Farah? Dr. Farah, are you hearing me?
Oh, sorry, I forgot to unmute.
Okay, what will be judgment?
If I take in the endoscopy part that was not mentioned to the patient,
Yes.
if I keep it in mind, then it will go in the borderline. Otherwise, the other
Yes.
things were okay.
I will suggest to cut mark here, because that will make Dr. Rahul conscious. Whenever you are going for any invasive procedure, like the endoscopy or colonoscopy or the biopsy, give the information to the patient, because there is a component of taking permission from the patient. Then
Okay,
welfare
and
is...
also
Yes, doctor.
And also another thing is that about the cancer, even though it's not our first DD, I would not I would not go in saying that there is no possibility, but I would like that
Yes.
yeah, it is one of our possibilities, but I am putting it back of the other possibilities, and I would be more sure after I run some scanning and some blood tests on you.
Yes, Dr. Rahul has given the answer in this way, that we'll do some test and we'll rule this out. Dr. Rahul has given this way answer.
Okay. And I would not mention that now this is not our possibility.
No, it is true. Yes, it is true that in the PACES exam, never tell anything in issue that yes, this is the diagnosis. Just mention most likely or less likely to keep in the safe side. He can mention that yes, it is less likely, but we'll rule it out.
Okay, and welfare is okay.
Yeah, welfare is okay. So based on this, what will be the judgment out of 14 from each examiner, doctor? Dr. Farah, give the mark, doctor.
8. It's 8 altogether.
Yes, it is 8. So if it is, you multiply it into 2, it will be 16
It
out
will
of
go 16.
28. So here is a learning point is that never synthesize any positive physical finding. And to correct the clinical communication skill, we have to practice a lot, following the format. Before starting for practicing, try to write the PDF sajit in the blank paper so that you don't miss any important part. Because from my experience, I have seen that these are simple part, but candidates make some mistake. The rest of the thing will be covered. So from now on, it will be the job of Dr. Farah to practice with Dr. Rahul. And Dr. Rahul has to practice with Dr. Farah every single day. Are you giving me the word doctors?
Okay, I can try.
No, you have to do. You cannot try. Dr. Rahul has also got seat at Diet 2, and Dr. Farah is also got seat in Diet 2. So you have to practice every single day and report to me. Dr. Rahul, are you with me, doctor?
Yes, sir. I am.
Okay, doctor. Don't be disheartened because this is the usual starting score.
No, sir,
So,
I'm not disheartened. I'm just thinking that, somehow I've actually also heard from other people that, if you start asking an acutely ill patient about, not driving, if you start addressing that, it's not impacting your quality, like, about like certain things about driving. And there was one more point that was raised. So the point is that, I'm just a little bit and you also said that we have to ask this, isn't it? Or else we'll be penalized. So I'm just a
yes,
bit
doctor.
conflicted there that, in real life, we are not asking this. And in
No, here
judgment also, a little
in the
bit
real.
like, of the, like, somebody can just ask you that, how can you ask for driving if, the patient is to be admitted? Obviously, the patient who's admitted will not drive. So I'm a little bit conflicting about mentioning it.
No, doctor. I
That's
suggest
what
you
I'm
to
saying. I
mention it.
have to convince myself that I have to mention it.
You have to mention it, doctor. This is for sure. You
Yes,
have to
sir.
mention it. And whenever you are confused, just mention stop driving till further assessment to keep you on the safe side.
Actually, Dr. Rahul, the best thing is to say that till further assessment, because we will not diagnose everything in a one day, no. So that we
Yes,
have to. This acute event may just subside, and it may happen again also. So we are not telling you that you stop driving. We are saying that you can stop it till we've come to some conclusion what problem you are having.
yeah, exactly, doctor. And
Yes.
if possible, I will collect some feedback and I will send it to you. That only for missing this important part, that not asking for driving, not asking for smoking, marks are cut in clinical communication skill. Happens, doctor, every now and then. These are very much simple parts, but at the same time, these simple parts are missed. And that's why you have to make a reflex of asking all the things. And this has to be developed by repeated practice, not only for practice with one session with me. You have to do practice with every single partner as much as you can. I am providing you all the things to practice.
Yes, sir. I'll keep that in mind. Thank you.
Okay, most welcome, doctor. So let's go to the next pair of candidates. So Dr. Munna, are you there, doctor?
Oh, yes.
Okay, let me find a partner for you. Dr. Danish, are you there, doctor? Dr. Danish? Can you hear me, doctor? Okay, Dr. Danish is not there. Dr. Nahida, are you there?
Yes, yeah, I'm here.
Okay. So right now, Dr. Munna will be the examinee and Dr. Nahida will be the examiner. And I will be the surrogate. Let me find a case for Dr. Munna. So this is your case, Dr. Munna. Are you seeing this screen, doctor?
Oh, yes.
Okay. And one message for the doctors is that actually simple things are missed easily. Your case might be very much simple, but whenever you are getting the feedback, you will see that you have missed some simple, silly mistake. That happens most of the time in the PACES exam. It can be only covered by doing repeated practice. For Dr. Munna, my suggestion will be in your blank paper, try to write the DD, try to write the PDF Sajid. Then go for
Okay,
history
fair.
taking.
Yes. Sure.
Okay.
Okay, should I start?
Okay, start, doctor.
Hello, I'm Dr. Bhuya, one of the doctors working here today. Can you please confirm your name and age?
Doctor, I'm Mr. Jacob. I'm 56 years old.
Okay, Mr. Jacob. Today I'm here to talk to you about the problem that you're having, and I'll also examine you. Is that all right?
All right, doctor.
Okay, during our consultation, if you feel like asking me about anything, just feel free to interrupt me. During our consultation, I will also take some notes and be assured that this will remain totally confidential.
Okay,
So,
doctor.
Mr. Jacob, can you please tell me what brings you here today?
Actually, doctor, I'm having some swallowing difficulty for the past few months, and it is getting worse day by day, doctor. I really need some help. Please help me, doctor.
Okay, I feel really sorry for you. Can you please tell me when does it occur? Does it occur at the start, or does it occur after you start eating?
Doctor,
Like
it
you put
starts
the
after.
food in your food pipe.
Yeah, it starts after my eating, doctor. After I start my eating, I feel like something is stuck behind my chest.
Okay, is it too solid, liquid, or both?
Doctor, actually, what happened? It started with solid, but right now I cannot even drink water, doctor. I don't know what is happening with me.
Okay, so started with solid. Now you are having difficulty to drink
Solid
even
and liquid.
liquids.
Yes, doctor.
Okay, all right. Can you please tell me with this swallowing difficulty, how are you taking food, or what type
I'm
of food are you taking?
I'm really not able to take proper amount of food, doctor. I feel really weak for that. Even I don't feel like eating anything, doctor.
Okay, that is I feel really sorry for you. Can you or do you feel like food getting stuck in your
Yes, doctor.
in your like in your chest?
Yes, doctor. I have mentioned this. I feel
Okay.
like food is
Have you
stuck there.
okay. Okay. Have you noticed any food particle coming through the back of your mouth?
Yes, doctor. Sometimes it comes out.
Okay. So well, does someone did someone ever told you that you are getting pale day by day?
Yes, doctor. My wife is still telling me that I'm getting pale, doctor.
Okay. So have you lost weight?
Yes, doctor. I have lost weight.
Okay. How's your appetite?
I have poor appetite, doctor. I don't feel like eating anything.
Okay. So can you mention how many kgs you have lost in how many months?
I have lost about 5 kg weights over the last 3 months.
5 kg in last 3 months. Okay. So do you have any lumps and bumps in anywhere of your body?
I did not notice, doctor.
Okay. So do you have any allergies?
No, doctor.
Do you feel like sometimes bad smell coming through your mouth?
No, doctor.
Okay. Do you feel pain while eating food in your like in
No,
your
doctor. I don't
food
feel
pipe?
anything.
Okay. So do you have any heartburn?
Actually, doctor, what happened? I used to have heartburn, but it is improved right now.
Okay, so your heartburn is improved right now. Did you have acid brush?
I used to have that. I used to have that heartburn and acid taste in the mouth for quite a long period of time. But this thing is getting improved, doctor. But well, at the same time, I'm having this swallowing difficulty.
Okay, all right. So okay. How's your back passage? How's your back passage?
My back passage is not good, doctor. I'm not able to eat anything. How can be my back passage, doctor?
Okay, so what about your water work?
Actually, doctor, it is also reduced because I cannot even drink water.
Okay, do you feel dizzy when standing from chair?
Yes, doctor, I feel dizzy standing from the sitting position.
Okay. Do you have any pain in your tummy?
No, doctor.
Okay. So just so that I don't miss anything, I would like to ask you some questions. Do you have any fever? You can ask. You can answer by yes or no. Do you have any fever?
No, doctor, I don't have.
Do you have any chest pain?
No, doctor.
Any palpitation?
No, doctor.
Okay. Do you have any pain anywhere in your body?
No, doctor.
Okay. So do you have any past medical condition that I should be aware of?
Only from this heartburn issue I had, and I had some.
Okay,
I am having some persistent dry cough.
okay, so you're having some dry cough.
Yeah,
Can you please tell me for how long have you been having this?
it's been there for the last 3 years, doctor.
Okay, does it come with phlegm?
Yeah, it has some phlegm, but it is mostly clear.
Mostly clear. Have you noticed any blood while
No, no, doctor.
coughing?
No.
Okay, so anything makes it worse, like if coughing gets worse with anything?
No, doctor.
Okay, anything makes it better?
Nothing like that. Actually, my doctor told me that I actually smoke, doctor, and he told me that it is happening due to my smoking.
Okay, so how many sticks do you smoke per day,
I
and for how
smoked
long?
about 25 cigarettes per day for the last 30 years, doctor.
Okay, Mr. Jacob, I'm really sorry to tell you that smoking is very harmful for your health. So if you want, I can refer you to a smoking cessation clinic. Is that all right?
Okay, doctor.
Okay. Do you have any other? Do you have any surgery? Have you had any surgery before?
No, doctor.
Any hospitalization?
No, doctor.
Okay. Any contact with sick patients?
No, doctor.
Okay. So any recent procedure, like any dental procedure or any
No, doctor.
infection?
No, doctor.
Okay. So can you do you take any regular medication?
I used to take omeprazole, doctor, with that tummy productive medication.
Okay. Anything else?
No, doctor.
Okay. Do you take any over-the-counter drugs?
No, doctor.
Any over-the-counter medications?
No, doctor.
Okay. Any herbal medication?
No, doctor.
Do you have any allergies to any medication?
No, doctor.
Okay. So, do you have any disease that runs in your family?
No, doctor. Actually, my father died of bowel cancer.
Okay. Well, I'm really sorry for that. Can you please tell me at what age
It was
he
on
died?
57 years of age.
Okay, 57 years of age. I'm
Yes.
really sorry for that. Do you have any family members suffering from your similar symptoms?
No, doctor.
Okay. Uh, I'd like to ask you some personal questions. Mr.
Sure.
Jacob, what do you do for living?
Doctor, I work as a businessman.
Okay. Can you please tell me how much your symptoms affect your job and your daily life?
Actually, doctor, I feel very weak and cannot maintain the activities of my business. I live with my wife, and right now my wife is supporting me for that.
Okay. So in that case, if you need support, we can refer you to a social occupational worker and social worker.
Okay,
Do you
doctor.
drink alcohol?
Yes, doctor, I drink. Social
Is it
with the
within show?
yeah, it is one social limit, doctor.
Okay. Do binge drinking?
No, doctor, I do not binge.
Okay. So, do you drive?
Yes, doctor, I drive. I drive my own car.
Okay, so you drive your own car. So for the time being, I would like to suggest you to stop driving for now till further assessment. Is that all right?
Okay, doctor.
Okay. Now I'd like to go to the examination.
Okay, what you want to examine?
Okay. Is there anemia,
Present.
dehydration?
Absent. How to check the dietitian?
Okay, I would like to check the patient's oral mucosa, tongue, and our capillary fill time.
Okay, absent.
Okay. What about the lungs? Is there any crepitations?
Absent, doctor.
Crepitations absent. I'd like to palpate the abdomen. Is there any hepatomegaly?
Absent, doctor.
Any shifting dullness?
Absent. Doctor,
Okay.
one and a half minute left.
Okay. I'd like to check the neck glands.
Absent.
Okay. I'd like to offer patient a glass of water to check the if there is any thyromegaly.
Absent, doctor.
Okay. So, Mr. Jacob, what is your concern?
Doctor, why I'm having this swallowing difficulty?
Okay, so after talking to you and after examining you, I have some differential. So my topmost suspicion is that you may have uh, you have what we call is esophageal cancer, and there can be some other possibilities
Explain,
like
explain the esophageal cancer without using jargon.
okay, so esophageal don't get bothered by this by the medical term. It is a condition in which there is a tumor forms in your upper food pipe that
Yes.
causes difficulty in swallowing food.
It can be cancer or bad growth.
It can also be any growth from lungs that is compressing your upper food pipe. So after So
So,
what we'll do is now is that we'll admit you for now, and we will run some tests, and we'll also do a camera test through your upper foot pipe, and after that we would be in a better position to tell you what is actually wrong with you.
okay, doctor. Thank you.
Do you have
Another
any
thing,
other concern, Mr. Jacob?
no, doctor. You have met all my concerns in one line. My suggestion will be just give the answer, whatever has been asked in the concern. Like you have told about the management. Let the surrogate of the patient ask this question that how do you manage me right now? Will it get cured? Are you getting it, doctor? You have mentioned the right thing that we'll go for endoscopy, but better to ask, reply the things that the patient has asked first. Then you can go for your thing. Have you got my point, doctor?
Hello, I think I got disconnected for a while.
Okay, I'm repeating. Actually, you have been asked that why I'm having this swallowing difficulty. You have explained this without using jargon. Then you are going for the management. My suggestion is better to ask the patient, do you have any other concern? Because this can be one another concern of the patient. And sometimes the surrogates are not that much well trained at all the centers. If whether you have met the concerns or not, it cannot be whether the surrogate has mentioned it or not, it will be counted. Like the surrogate has asked, how should I get managed? You have given the answer, it is true. But better to ask it to the patient than give answer.
Okay, ma'am. Yes, sure.
Did you get my point right now?
Yes.
Okay. So the way is in the PACES exam, try to speak as less as possible. And let the examiner poke you as much as I can regarding the question and the concern. So, doctor, do you have any diagnosis or differential diagnosis?
Okay, I have some differentials. My first differential is C. esophagus. If the patient had, in the history, patient had swallowing difficulty initially with solids and then later it progressed to liquids.
Yes.
And also patient had a history of cough and smoking history. So I would like my second differential is CL lung compressing from outside. I have other difficult the other I have another differential that is esophageal stricture, but as the patient has weight loss and the warning signs, I would like to say my first differential is esophagus.
Okay. So what are the positive physical findings, doctor?
Okay, so in positive differential findings, I have got
Positive
the
physical
patient was
finding.
anemic. The patient was anemic.
Yes. Anything else?
No, nothing else was present.
Are you sure? Was not there. Are you sure enough that nothing was there?
Okay, so I should have checked some other things like postural hypertension, like sitting and standing blood pressure, and I would like to, I should have done a digital rectal examination,
Okay, but
offered at least.
from your physical examination, do you think you have missed any important part or anything?
I don't know the important part.
Do you want to add any physical findings? Sorry.
Okay, I'd like to check sitting and standing blood pressure, and I'd
Yeah, apart
like
from
to
this, from
check
your
neck
examination,
glands.
you have
Neck
checked it,
glands.
doctor. Did you get positive there?
No, there was no lymph nodes.
Okay. Anything else you want to add?
I'd like to auscultate the chest more in details.
You have checked it. Did you get anything positive there? Any crepitation, doctor?
There was no crepitation.
Okay. Anything else? Okay, doctor. How would you like to investigate?
Okay, so apart from basic investigations, to confirm my diagnosis and also to find out the cause, I'd like to do upper GI endoscopy and biopsy. And to see complications, I will do CBC to see anemia. And I'd like to do chest X-ray if there is any consolidation to see if the patient has any aspiration pneumonia or not. And I'd also like to do ultrasonogram of whole abdomen and liver function test to see any metastasis.
Wonderful. So how do you like to manage?
Okay, so as in this case, the patient has postural hypertension, that is, she has dizziness. He has dizziness. I would like to admit him, and I would like to manage airway breathing and circulation, and then form a multidisciplinary. And I would like to educate and counseling the patient, form a multidisciplinary team. I will give a referral to gastroenterology department to perform an upper GI endoscopy, and
Anything else?
also
Okay.
and then further management would depend on the cause.
Okay.
I would like to give IV fluid, airway breathing
Ensure the
circulation test.
nutrition. Just you have mentioned the multidisciplinary team that will cover because in the multidisciplinary team there will be nutritionist, also the speech therapist. They will ensure the nutrition. So, doctor, why you are confused? I just poked you to synthesize any positive physical finding. This thing, something happens in the PACES exam, so that you synthesize anything that is not there. I was just checking your confidence. This thing exactly happens in the PACES exam. Do you want to add anything?
Okay, so what happened is that I just forgot if you have said yes or no in some I just forgot you have said no in neck glands. So that was
no problem. But be confident of whatever findings you have got, even after poking for some time. Like, do you want to add anything? Have you missed anything? Don't go for that. Whatever you have seen, just be truthful to that. And in the PACES exam, sometimes omitting is better than committing. Because if you synthesize one positive finding that is not there, in the identifying physical signs, it will automatically become 0. Are you getting it, doctor?
Yes, sure.
So it was just an acting. It will be done many times in this course. Don't be frightened of that. So, Dr. Nahida, are you there, doctor? Dr. Nahida, can you hear me?
Yes, ma'am, I'm hearing you.
Okay, so let's give mark to Dr. Munna. his performance was very much wonderful.
Yes, yeah. Dr. Munna did a great job actually in here.
Yes. So let's see how much mark he can get. In the physical examination, what will be your judgment, doctor?
I think I will give satisfactory.
Yes, it is.
He checked everything.
Then identifying physical signs?
Yes, physical science, yes. Actually, yes, he touched everything.
Yes, doctor, it is satisfactory. Then clinical communication skill?
It was good.
Wonderful. He just mentioned all the things, and I actually did not expected such performance in the first day.
Yes.
Then differential diagnosis?
A differential diagnosis, I will give the satisfactory.
Yes, it is. And clinical judgment?
Clinical judgment, yes, I will give the satisfactory.
Yes. Consent management?
He made the concern of the patient, so I will give the satisfactory, yes.
Yes. One thing I will add, it will not cut mark to Dr. Munna, that you have mentioned that we will go for some camera test. After taking your permission, just mention this line.
Okay, sure.
Because permission is the issue. That will prove you more professional. And welfare is also satisfactory. So
Yes.
congratulations, Dr. Munna. And we have got our champion for today. For every session, whoever gets full mark, he will become the champion for that session. It will continue for the further sessions also. So,
Congratulations.
Thank you.
Dr. Munna.
Yes, doctor.
Thank you.
Keep it up, doctor. So, Dr. Nahida, what will be the total mark from each examiner out of 14?
I forgot the number distribution.
For each satisfactory, it will be 2. There are 7 skills. So 2 into 7?
14.
Yes, 14. We have to multiply it into 2 from both the examiners. So it is 28 out of 28. And Dr. Munna has got 28. Good job, Dr. Munna. Do you have any question? Dr. Munna?
No, I have actually it was the first case, so me and my friend practiced it twice. So
that is the reason. The more you practice, the more it will become perfect. And one of the doctor asked, what was the differential diagnosis? For this case, the differential diagnosis will be first carcinoma, that is all right. Second, it will be esophageal stricture. In this carcinoma, it can be carcinoma of the stomach. Also, it can be carcinoma of the lung, compressing the esophagus. All these things have been provided already in the form of PDF sheet with homework. So good job, Dr. Munna. Now it is your turn to act as an examiner and give judgment to Dr. Nahida.
sure.
LCC is not that much difficult. You just have to follow the way. And you have to do the repeated practice. That's all. So let me find the case for Dr. Nahida right now. So this is your case, Dr. Nahida. Are you seeing the screen, doctor?
Yes, I'm seeing the screen.
Okay, you have 2 minutes time.
Okay. Yeah, we can start.
Okay. Let's start, doctor.
Okay. Hello, ma'am. I'm Dr. Nahida, one of the doctor in this clinic. May I confirm your name and age, please?
Doctor, I'm Miss Laura. I'm 20 years old.
Okay. Okay, ma'am. Nice to meet you. I have been told that you are suffering from tummy pain. Is it all right?
Yes, doctor.
Okay. I'm really sorry to hear that, and I will try my level best to hear you out and help you out from your condition. Okay, so to do that, I need to ask you some questions, and I will do some examinations. Is that all right with you?
Okay, doctor.
Okay. So, ma'am, can you please tell me from when your pain started?
Actually, doctor, I'm having this tummy pain for recurrent episode, and I'm having this from today's morning. It comes and goes, and I'm feeling so much bother for this pain, doctor, and really need some help. Please help me.
I'm really sorry to hear that. And after examination and total procedure, I will give you some painkillers to relieve your pain. Okay, ma'am?
Okay, doctor.
Okay. And can you please tell me, is it the first time are you having this pain?
Yes, doctor. Actually, right now I'm not having this pain. Today morning I had this pain, and then it went on. It comes and go, and this is not the first time, ma'am. It is happening for recurrent episodes.
Okay, all right. And does it come? Does it comes? Does it goes to anywhere else?
No, doctor.
Okay. And does this pain has any specific nature? Does it comes in night time or it stays in the same manner in the whole day?
No, doctor.
Okay.
It can come
And
anytime.
anytime. Okay. And is there anything that relieves the pain?
No, doctor. I have tried many things, but it did not help.
Anything that increases your pain?
That is also not true. I have not found anything in particular that increases my pain.
Okay. And if I told you to score your pain from 1 to 10, um, 0 is the minimum, 1 is the minimum, and 10 is the maximum. How will you score your pain?
Whenever the pain comes, it is about 4 to 5 out of 10, doctor.
4 out of 10. Okay. And okay. And do you have any fever?
No, doctor.
Do you have any joint pain?
No, doctor.
Okay. And do you have any rash or lumps or bumps in any parts of your body?
No, doctor.
And what about your blood sugar level?
I don't have any issue with that.
Okay. What about your blood pressure? Did you check it?
It is normal, doctor.
Okay. Do you have any other medical condition that I should be aware of?
No, doctor.
Okay. Any surgical history previously?
No, doctor.
Okay. What about your family members? Are they doing fine?
Actually, doctor, my father also used to have this tummy pain.
Okay, sorry to hear that. And how is he doing now?
Actually, doctor, he died of road traffic accident.
I'm so sorry to hear that, ma'am. Okay.
Thank you, doctor.
And
It's okay.
what about your other family members? Are they doing fine?
Yes, doctor, they are doing fine.
Okay. So, ma'am, do you have any weight changes recently?
No, ma'am.
Okay. Are you getting paler day by day, or someone noticed any color changes?
No, doctor.
Any appearance changes?
No, doctor.
Okay. Do you have any weather preferences, ma'am?
No, doctor.
Okay. And do you have any history of throwing up anytime?
No, doctor.
And does this tummy pain has any relation with your food taking?
No, doctor. I did not find any such type of relation.
And do you have any kind of a heartburn?
No, doctor.
Any acid taste in your mouth?
No, doctor.
Okay. Do you feel any flatulence or any kind of heavy feeling in your abdomen, in your
No,
tummy?
doctor. No, doctor. It's called bloating. No, doctor.
Blood. Okay. Do you have any short of breath?
No, doctor.
Okay. And any racing pacing of your heart?
Whenever the pain comes, I feel this racing pacing.
Okay. And you mentioned that you don't have any joint pain, right?
No, doctor. Yes, I don't have.
Okay. Do you have any noisy breathing?
Right now I'm not having any noisy breathing, doctor.
Okay. Any kind of night sweating anytime?
No, doctor.
Any headache?
No, doctor.
Any pins and needles in any part of your body?
No, doctor.
Okay. And you also mentioned that you don't have any issues with your fever, right?
Yes, I don't have any fever, doctor. Even I don't have any pain right now, but the pain comes and goes, and that makes me very much bothered, doctor.
I can understand. Okay, ma'am. And do you have any problem with your walking?
No, doctor.
Okay. Do you have any partner?
Yes,
Any
doctor. I have my boyfriend.
Okay. Any casual contact other than your regular partner? I'm sorry to ask that.
No, doctor.
Okay. And ma'am, I also want to ask another question, which could be very personal, but I'm sorry to ask that. What about your period?
It is okay, doctor. It is normal and regular.
Okay. Did you anytime plan for your pregnancy or anything?
No, doctor.
Okay. Did you travel recently?
No, doctor.
Okay. And what about your back passage?
It is normal, doctor.
Okay. What about your water work?
It is also okay.
Okay. Do you have any kind of allergy to the medication or any kind of food?
No, doctor.
Okay. Okay. Do you feel any dizzy when you stand up from the sitting position?
No, doctor.
All right. Do you have any visual disturbances?
No, doctor.
Okay. Ma'am, what do you do for a living?
Doctor, I'm a student.
Okay. And so you have anyone to support you at home?
Yes, doctor. I'm supported, doctor.
Okay. Do you smoke?
Yes, doctor. I smoke.
Okay, ma'am. Any kind of smoking is injurious to health. But you have to stop the smoking. But if you need any help, we can refer you to the smoking cessation clinic. They can help you regarding this. Is that all right with you?
Okay, just make a pause. In the PACES exam, never give the advice like you have to do this. It will be better if you stop smoking. Are you getting, doctor?
Okay, ma'am. Okay, and do you drink?
Yes, doctor. I drink socially.
Socially. Okay. And do you drive?
No, doctor. I do not drive.
Okay, I have to examine the patient.
Okay, what do you want to see?
I want to check the patient's anemia.
Absent.
What about, and is there any jaundice?
Absent, doctor.
Okay. What about inside the mouth? I want to check the tongue.
Normal.
Okay. And also I want to check the patient's lymph nodes.
Absent.
What about the thyroid gland?
Non-exhaling is present.
Okay. And also I want to check any is there any bruising or any kind of any discoloration any part of your body?
No, doctor.
Okay. And I want to check the patient's I want to do the abdominal examination. Is there any tenderness in superficial palpation or any
Absent, doctor.
deep palpation?
Absent.
Sorry.
No tenderness is present.
Okay. Is there any organomegaly?
Absent, doctor.
Okay. And I want to check the edema.
Absent, doctor.
Okay. And I also want to check the patient's
1.5 minutes left, doctor.
okay. I want to auscultate the chest.
Normal.
Okay. And so, ma'am, what's your concern with me?
Doctor, why I'm having this tummy pain?
Okay. As, after talking to you and examining you, I think your tummy pain could be due to many reasons. I have some differentials in my mind. It could be due to, as your father is has some problem, family problem. It could be due to as a sequelae of your family problem. It could be due to hereditary angioedema, or also it could be due to uh, as you are a student, you might be going through some stresses, or it could be due to IBS, and also there must be possibility of having peptic ulcer disease.
Doctor, is it curable?
Yes, ma'am, this is curable. And regarding your problem, at first we'll run some test, and after the test, we'll form a multidisciplinary team, including the tummy doctor and the other doctors to solve your problems, and they can.
Time's up, doctor.
Okay. Okay. Thank
So,
you. Thank you so much, ma'am.
Thank you, doctor. So, doctor, do you have any diagnosis or differential diagnosis?
I have some differential diagnosis for this patient.
Okay. What are your DD?
My DD is, it could be due to hereditary angioedema.
What makes you think for that?
His father has
Anything else?
As it is a recurrent.
Yes. Anything else that will be also positive in hereditary angioedema? Or what else you can think of?
Patient might have some tongue swelling.
So did you ask it?
No, I didn't ask it about it.
Anything else apart from tongue swelling?
Patient might have facial swelling also.
Okay, let me do. Any other differential diagnosis?
It could be due to peptic ulcer disease.
Is peptic ulcer disease recurrent and familial, doctor?
No.
What is the site of peptic ulcer disease? It is epigastric, doctor. Here, did you ask the site?
No, I didn't ask about the site.
Okay. So, do you want to mention any other DD?
It could be due to IBS.
What makes you think of IBS?
As she's a student, she might going through some stress.
Did you ask about the stress?
No, I didn't ask.
Okay. So what are the positive physical findings, doctor?
On physical findings, there is no specific physical findings for this patient actually.
Okay, doctor. So how would you like to investigate?
At first, I have to do the CBC with ESR. I want to check the CRP levels, and also I want to do a chest X-ray, and I want to do ultrasonography of the whole abdomen.
Okay. Anything else?
I want to do the I want to do the liver function test also.
Okay. Anything else?
And I want to do the endoscopy.
Okay, endoscopy for what?
As I'm suspecting the peptic ulcer, as my DD was peptic ulcer disease, so that's why I put it in there. But in the after all the investigation has been excluded, then I want to do that.
Okay. So how to manage this patient?
At first, to relieve the abdominal pain, as the patient has now, as this patient is not having any abdominal pain, so she doesn't need any painkiller right now. But I also want to, as I'm suspecting it's a familial condition, I want to also involve the genetic counselor.
Okay. Anything else? What will be initial management?
Initial management. Okay. I don't know what this patient right now need actually, as she's not having any symptoms right now.
Okay. Okay. Let's start giving the judgment. So, Dr. Munna, are you there, doctor?
Yes.
So this is a case of tummy pain. Before discussing the feedback, let me discuss with Dr. Nahida. So, Dr. Nahida, can you remember the causes of recurrent pain with family history from a lecture we discussed?
Yeah, it could be due to hereditary angioedema, familial Mediterranean fever, or could be due to
Hereditary angioedema, or acute intermittent porphyria.
acute intermittent porphyria.
These
Yes.
three have family history. Apart from this, it can be ADPKD. But how to rule out the hereditary angioedema? It is good you have mentioned about the facial swelling, but you did not ask it to the patient. Any other question you can ask to rule out hereditary angioedema, you think? The question
Any
is
shortness of breath during pain?
Yes, any shortness of breath during that tongue pain. Did you get it, Dr. Nahida?
Yes, ma'am.
You wonderfully asked, was there any joint pain? Because in familial Mediterranean fever, there will be joint pain. And in acute intermittent porphyria, there will be any neurological symptom like anxiety, like convulsion. And there can be some past medical history of surgery because this mimics acute abdomen. So you have to mention like this. Another thing is that in the approach, like you were very much focused. In the flowchart, if you notice, I repeatedly told you that always ask the open question. Like in your own words, could you please tell me what brings you here today? From the very beginning, you asked that I have come to know that you have tummy pain. Actually, this is a wrong approach because what happens, sometimes the surrogate are there to give you a lot of information. But if you ask from the tummy pain from the beginning, then he will not give you any other information apart from tummy pain. This line is open question, but you went on to the closed question. Did you get it, doctor?
Yes, ma'am.
It can be easily corrected, doctor, through repeated practice. Just follow this flowchart. So based on this, Dr. Munna, what will be Dr. Nahida's performance in physical examination? It is a dummy case. It will be 100% dummy case in the PACES exam, and you will not get any positive physical findings.
Yeah, I think she checked almost everything, but
it
will be satisfactory.
It will be satisfactory. Then identifying physical signs.
It would also be satisfactory as the patient
Yes.
was it was a dummy case and there was no.
It will be satisfactory. Then clinical communication skill.
Should we check the kidneys in abdomen palpation?
It is not actually whenever anyone is doing abdominal examination, kidney will be covered because this is part of the abdominal examination. Whenever you will cover the short case, it will become clear to you. Then regarding the clinical communication skill, what will be your judgment, doctor?
Okay, I think during questions, as the patient was not in pain and as she was having recurrent abdominal pain, we should have asked when you have pain, did you have that symptom?
Yes, this is the screening question for DD. So this will be written in this way that candidate did not ask, rule out the DD. Sorry, it will be written like this. The handwriting will be very much bad. Candidate did not rule out the DD. Another thing will be written like asking focused question. Sorry, asking closed question, not focused. Anything else you want to add, doctor?
No, that is it.
Okay, so what will be the judgment then?
I would say borderline in clinical communication.
It will be borderline. Then come to the differential diagnosis. What will be your judgment, doctor? Doctor,
I think this is satisfactory.
No, doctor. She has mentioned only hereditary angioedema. That is the only one DD, but she did not mention the acute intermittent porphyria. Rather, she mentioned the peptic ulcer disease, which should not be there, because peptic ulcer disease is not a recurrent cause of tummy pain. And also in the clinical communication skill, Dr. Nahida did not analyze the tummy pain. Like, what is the site? Is there any radiation there? It was not assessed.
Yes, that's right.
Are you getting it, Dr. Nahida?
Yes, Bhaiya. Yes.
Don't worry, it is the usual mistake and it will automatically get corrected. Just compare your performance from today and 7 session after, if you do repeated practice. So what will be the judgment in differential diagnosis, doctor?
Borderline.
It will be borderline. Then clinical judgment. Did she mention the investigation and management?
No,
not at all. Because in hereditary angioedema, we have to do C1 esterase inhibitor. And also we have to offer some prophylaxis. The biggest mistake is that she has mentioned about endoscopy. For UK, endoscopy is an invasive procedure and there has to be some negative symptoms to do the endoscopy, like blood vomiting, loss of weight, loss of appetite, dysphagia, some heartburn appearing at old age. There are some guidelines written in the NICE guideline. Unnecessary endoscopy is strongly contraindicated. It is not like that we are not getting any cause, then we are going for endoscopy. That is not our decision. This decision will be taken by the gastroenterologist if even after it has to be done. But for this patient, she is young, she does not have any negative symptoms. So if you mention endoscopy, automatically all the marks will be gone in clinical judgment. It will be written that unnecessary endoscopy, doing invasive investigation, and they will mark that you are not a safe doctor. Are you getting Dr. Nahida?
Yes, I'm getting it.
So it will become unsatisfactory, doctor, in the clinical judgment.
Yes.
Then managing patient concern. Dr. Munna.
I think that would be borderline.
Doctor, I think that is be unsatisfactory because, sorry, it will be borderline because Dr. Nahida mentioned the hereditary angioedema, but she could not explain it without using jargon. Hereditary angioedema would be a jargon. How to describe it without using jargon? You can just mention this is a familial disease, meaning disease running in the family which affects multiple parts of our body, like the tummy, like the tongue, like the lip. Are you getting it, Dr. Nahida?
Yes, I'm getting it.
So you have to practice it multiple times. And also you have mentioned the term differential diagnosis. The term will be several possibilities because differential diagnosis will be a jargon to the patient. We have to, all these things will be covered if you do repeated practice. You will find your own words, how to explain this without using jargon. But this reflex has to be developed by yourself, by doing practice with your Dr. Munna.
Okay.
So it will be borderline and managing patient concern. So welfare is satisfactory. So based on this, what will be the total mark out of 14, Dr. Munna, from each examiner?
From each examiner, it will be 9.
Yes, 9. If we multiply it into 2, it will be 18 out of 24. Don't worry, you have to develop it. And from today on, you have to practice with Dr. Munna. And you have to report me every day. You will get time for at best 1 day to take preparation for the next system, the musculoskeletal system. And you have to do the practice repeatedly. So from now on, Dr. Munna has to practice with Dr. Nahida, and Dr. Nahida has to practice with Dr. Munna. Are you getting my points, doctor?
Yes, sure.
Okay, ma'am.
Okay. Dr. Nahida, do you have any other question?
No, ma'am.
Okay. So let me go to the next pair of candidates. Dr. Shrutish, are you there, doctor?
Sir, can I do next time, please?
Again, I'm sorry because suddenly my iPad got hangover. Actually, it has got old. That's why sometimes it becomes this kind of collapsed. I'm extremely sorry for that. So may I know, Dr. Satish, are you there?
Sir, can I
Am
do
I-
next?
Okay, doctor. Let me find a partner. So, Dr. Shan, are you there, doctor? Dr. Shan, Dr. Danish, Dr. Saim, is anybody there? Oh, these three doctors are not there. Okay, let me find an examiner for Dr. Satish. Let me see who is there. So, Dr. Nahida, are you there, doctor?
Yes, ma'am. I'm here.
Can you help Dr. Satish getting the feedback?
Yeah, sure, ma'am.
Okay. So let me find a case for Dr. Satish. So this is your case, Dr. Satish. Are you seeing the screen, doctor?
Yes, sir.
Okay. Are you ready, doctor?
Yes, sir.
Can we start?
Yes, sir.
Okay,
Hello,
start.
Hello, I'm Dr. Satish. I'm one of the doctors here today. Can I confirm your name and age, please?
Just, yeah. Hello, doctor. I'm Mrs. Jessica. I'm 35 years old.
This is Jessica. Today we are here to discuss about your health conditions. Meanwhile, I'll be taking some notes and examine you. So, is it okay for you?
Yes, doctor, it's okay.
So, can you tell me in your own words what brings you here?
Doctor, I'm having some swallowing difficulty for the last 10 days, doctor. And I'm feeling really difficult to swallow foods for that. Please help me, doctor.
So, can you tell me what do you mean by swallowing difficulty? Do you have any pain or do you have any swallowing difficulty as such?
I'm having swallowing difficulty, doctor.
So, no pain.
No pain
So,
during swallowing.
can you tell me any specific part of the day you are having this swallowing difficulty?
I face it almost all over the day.
And can you tell me, is it for liquids or solids or both?
It is too both, doctor.
So, can you tell me this is the first time you are having this problem, or you had it before also?
No, doctor, this is the first time.
Okay. So, can you tell me when this swallowing difficulty is at the beginning of the swelling, or it is after sometimes you have
After sometimes, doctor. After I start eating, after I put the food bolus into my mouth, then it starts.
Okay. And do you have any pain while swallowing?
No, doctor.
Okay. Do you have any feeling sick or throwing up?
No, doctor.
And do you have any raised body temperature?
No, doctor.
Any lumps and bumps anywhere in the body?
No, doctor.
Do you have any rash? Do you notice any rash over your body?
No, doctor.
Okay. Do you have any weight changes?
No, doctor.
Any? How is your appetite?
My appetite is okay, doctor, but I cannot swallow food.
Okay. And how is your mood?
My mood is okay.
Is there any water work changes in terms of frequency, amount?
No, doctor.
And what about your bowel work? Is there any bowel changes?
No, doctor. It is okay.
Okay. So, do you have any mouth sores?
No, doctor.
Any dryness of eyes?
No, doctor.
Any tummy pain?
No, doctor.
Any tummy distension?
No, doctor.
Any change in your voice?
No, doctor.
Okay. Do you have any significant past medical illness that I should be aware of? That should be known.
I only had high blood pressure, doctor.
Since how many days?
Also high blood pressure and some anxiety issue. I have been diagnosed with high blood pressure for the last 1 year.
1 year. And what medications you are on?
For the high blood pressure, I'm taking tablet losartan 50 milligram. And for the anxiety issue, I'm taking tablet citalopram and tablet propranolol.
Okay. Any drug, apart from that, any other medication you're on?
No, doctor.
Any allergic to medication?
No, doctor.
Any over-the-counter drugs? Medications?
No, doctor.
And I'm sorry to ask you, any recreational drugs?
No, doctor.
So, do you have any, apart from this thing, do you have any recent surgeries?
No, doctor.
Any recent procedures?
No, doctor.
And anyone in your family have similar problems?
No, doctor.
Anyone in your family have bowel cancer or cancer of any type?
No, doctor.
May I ask you some personal questions? Are you on, how is your periods?
My period is okay, doctor.
And what about your, are you on any birth control pills?
Yes, doctor. I take birth control pills.
Since how many days or years?
I'm taking for the last 5 years, doctor.
Okay. And any recent, by any chance you are pregnant nowadays?
No, doctor.
Any pregnancy loss, recent pregnancy loss?
Yes, doctor. I had 2 episodes of child loss.
Since when? At what?
It was, all of them was before 20 weeks.
Before 20 weeks. Okay. Any, okay. So, do you have any difficulty in breathing?
No, doctor.
Any change in voice?
No, doctor.
Any leg swelling?
No, doctor.
Okay. Okay. May I ask you some personal questions? So, Jessica.
Let me just mute.
Hello.
Yes, doctor.
If someone, do you notice that you are becoming pale day by day?
No, doctor.
May I ask you some personal question? Do you smoke, Mrs. Jessica?
Yes, doctor. I don't smoke, doctor.
And do you take alcohol?
Sometimes, doctor. With the friends at party.
Okay. Is it a social drink?
Yes, doctor. It is within social limit.
Any binge drinks?
No, doctor. I do not binge.
Okay. What do you do for your living, Miss Jessica?
Doctor, I am a housewife.
And may I ask you if these symptoms impacting your day-to-day life?
Yes, doctor. It is affecting a lot because I cannot eat food. It's making me anxious, doctor.
Okay, I'm very sorry to hear about that. And at the end of consultation, we'll find some solution for it. And do you drive, Mrs. Jessica?
No, doctor.
Okay. And do you take balanced diet?
Yes, I try to take balanced diet.
Okay, sir. So can I examine you, Mrs.
Sure.
Jessica?
What do you want to see?
Yes, I would first of all I would like to see for hands if there is any pallor.
Hand pallor absent.
Okay, and I will see if they're in tightness of the skin.
Yes, it is present.
So I will ask her pinch test. I will ask her to pinch her this thing skin at fingers and above the elbow.
Okay, the skin thickness is present below the elbow.
Okay, and any rash?
Rash means at which part you want to look for rash?
Any rash? I want to do a skin survey for looking for any rash. For
There
instance,
are
salt.
salt and pepper appearance is present at the arm and the chest.
Okay, and then I will ask for vitals and postural drop in blood pressure.
Same is given outside.
Okay, is there any postural drop?
No.
Then I will ask for any proximal myopathy.
Absent.
Then coming to the face, I will see any hair loss.
Absent, doctor.
Then any rash over the face, Miller rash.
Same as you are seeing in the picture.
Okay, sir. And any eyes, coming to the eyes, any pallor or jaundice?
Absent, doctor.
Then I will ask to open her mouth.
The mouth openness is decreased.
Okay, and I will quickly put a torch and ask her to say ah.
Normal, doctor.
Okay, then coming to the neck gland, I will quickly palpate the neck to see for any thyroid swelling.
Absent, doctor.
And any cervical lymph nodes.
Absent.
Then coming to the cardiac examination, I will auscultate for S1, S2 and any murmur.
Absent, doctor. So in the neck, you want to palpate the thyroid swelling.
I want to take for thyroid swelling, sir.
How to check the thyroid swelling?
Inspection only for thyroid. I will ask her to swallow. I will offer her to swallow. Glass of
This is the way to check thyroid swelling. Take a sip of water and swallow.
Yes, sir.
Okay.
Yes.
Proceed,
Coming to respiratory system, I will see if there are any basal crepitations.
Absent, doctor.
And chest expansion.
Normal.
Okay. Then coming to the per abdominal examination, I will quickly.
2 minutes left, doctor.
Any organomegaly?
Absent, doctor.
Any bowel sounds?
Normal.
And coming to the legs, I will see for any pedal edema.
Absent, doctor.
So, what are your concerns, Mrs. Jessica?
Doctor, why I'm having this swallowing difficulty? Am I having cancer?
The swallowing difficulty you are having is most probably because of the underlying condition, what we call as systemic sclerosis. This is the condition in which the body's defense mechanism or body's defense system is acting against your multiple organs, involving skin, your joints, and your tummy also. This is the reason you are having difficulty in swallowing, Mrs. Jessica. Any other concerns?
Doctor, is it cancer?
Yeah, I don't think, means initially after examining you and after taking history, the chances of cancer, you are having cancer are very less, Mrs. Jessica. However, we are going to do certain tests. We'll run certain tests and let you know.
Okay, doctor. Doctor, is it curable?
It is not a curable condition. However, with regular follow-up and medication, your conditions can be controlled, Mrs. Jessica.
Okay, doctor. Doctor, do I need admission?
Right now, we'll do some investigations on OPD basis, and we'll come and after that, we'll keep you under regular follow-up.
Okay, doctor. Thank you, doctor. We still have 15 seconds left.
Any other concerns?
So time's up, doctor.
Okay.
So, doctor, do you have any diagnosis or differential diagnosis?
This lady has come with swallowing difficulty, and on the background of her, she has systemic sclerosis. So my differential diagnosis will be dysphagia due to systemic sclerosis.
What kind of systemic sclerosis is it, doctor?
She has limited cutaneous systemic involvement.
Okay. What are the positive physical findings, doctor?
She has skin pinch test is positive. Then she has proximal myopathy. Then she has peculiar saltpeter rash over her shoulders. Shawl side is positive. Then I can see she has a rash over her face also, and the opening of mouth is limited to limited. What I can see. Other than this, there are no other positive findings I can elicit this state.
Did you check the hands? Looking for sclerodectomy? Think that
Yes, yes. Digital ulcers and sclerodactyly I should have checked.
Did you ask the question of Raynaud's?
No, sir, I didn't ask. But I would like to ask whether your skin color changes after exposure to cold weather.
Okay. So, how do you like to investigate?
So, apart from basic investigation, that are CBC, ESR, CRP, and liver and kidney function test, to confirm my diagnosis, I would like to do an upper GI endoscopy and barium upper GI endoscopy and barium swallow. And to confirm the cause for her cause, I would like to do anti-nuclear antibodies, anti-DS-DNA antibodies, and anti-SCL.
What is the indication of doing endoscopy here?
Sir, she has come with difficulty in swallowing, so
okay.
I would like to.
Is any negative symptom, like in a young lady not having any loss of weight, loss of appetite?
No, she don't. I didn't ask, but no, she don't have any loss of appetite, and her weight is.
So, what kind of esophageal dysphagia is it? Is it motility disorder or mechanical dysphagia?
She has mechanical dysphagia.
Mechanical, doctor, or motility? In systemic sclerosis?
She has motility disorder. Motility dysphagia.
Let me go to the approach again. We discussed. So, this is the motility disorder. Achalasia, systemic sclerosis, and diffuse esophageal swallow. To diagnose the motility disorder, you can go for barium swallow and esophageal manometry.
Yes, sir.
Endoscopy is an invasive procedure, and it cannot be done unless indicated. The indications are like any red flag sign like loss of weight, loss of appetite, appearance of new onset dysphagia, or the heartburn in old age. That's an indication. But if you mention the endoscopy for this case, that can affect your mark in clinical judgment.
Yes.
Are you getting it, doctor?
Yes, sir. I got it.
So, how do you like to investigation cover? How do you like to manage?
For her dysphagia, I will ask patient education and counseling, and formation of specialist doctor, multidisciplinary team, including dietitians. Then I will give prokinetic dose, for example, domperidone, for her dysphagia. And once her diagnosis of systemic sclerosis is established, we'll start her on steroids. And
never make this mistake, doctor.
Yes, yes.
Steroid is contraindicated in systemic sclerosis. It can precipitate scleroderma renal crisis.
Yes, sir. Treatment of the symptomatic treatment.
Symptomatic treatment, then you have to refer this patient to the rheumatologist.
Yes.
You are working there as a registrar. You are not working there as a consultant. So you don't have to take the responsibility of doing every treatment, doctor.
Yes, sir.
We have to know.
And refer to rheumatologist.
Yes, doctor. We have to know our level there. Unless it is not possible that we have to know all the treatment, and that is not needed for passing the PACES exam.
Yes, sir.
So, doctor, actually, I would like to make you some things like in the flow chart. What we discussed, rheumatological. Okay, it was discussed in yesterday. Like this rheumatology screening question was missed, doctor. It was given in that period, in the first period. Any change in color of the skin after exposure to the cold, any joint pain, stiffness, any skin thickening, difficulty in raising arm, hair fall, grittiness of eye redness, skin rash, mouth sore, chest pain, tummy pain. Are you getting it, doctor?
Yes.
So better to memorize this flowchart.
Yes.
So let's come to your judgment. So Dr. Nahida, are you there, doctor?
Yes, I'm here. Yeah.
So this is a case of dysphagia due to systemic sclerosis. This is a very much common case, and systemic sclerosis patient can be given in multiple ways. It can be given as swallowing difficulty. It can be given as hand pain. It can be given as loose motion. Even it can be given as breathlessness and dry cough. So based on Dr. Shotish's performance, what will be your judgment in physical examination?
In physical examination, he actually did very good, but I think he missed some point, like he didn't check the fingers.
Yes.
And
Then?
also he, I don't know if it is necessary or not, but I think he missed to check the P2 and heave.
Actually, P2 and heave has to be checked whenever there is pulmonary fibrosis or ILD.
Okay.
And also in systemic sclerosis, loud P2 can happen automatically. Like chronic pulmonary embolism can be happen without having ILD. It is also true, doctor. Yes, then it is necessary to check it. But apart from that, an important part of the examination has been missed. Can you identify? At Hyderabad, one time, from the feedback, only from I have seen, only for not doing this examination, mark was cut. It is not like that you have to do this examination, but you have to offer this. And this is bedside capillaroscopy.
Bedside capillaroscopy, I must.
Yes, for every Raynaud's, this has to be offered. You never have to do this examination, but you have to offer to check bedside capillaroscopy, because by doing this examination, Raynaud's phenomenon can be differentiated from Raynaud's disease. And if you don't do this, mark will be cut. So based on this, what will be your judgment, Dr. Nahida?
Okay, I will give him satisfactory actually.
No, it will never be satisfactory. At least borderline. Some like tough examiners will give it unsatisfactory, but better to be borderline, I think.
All right.
Then identifying physical signs, Dr. Shodish could not identify the fingertip ulceration.
Yes, he missed this one.
Yes. So what will be the judgment there?
Also, it would be borderline.
Yes, it will be, doctor. Then in the clinical communication skill?
He communicated very well, actually.
Yes, then?
I think it was satisfactory.
But he was focused in family history again. He asked any similar complaint in the family and a family history of bowel cancer. Did not ask any disease apart from this, like any disease I should be aware of. Why I'm telling it? Because sometimes surrogate may not be that much helpful that we think of. Sometimes they just keep some nurse or something who is not even trained. During my time, I passed at second attempt. During my first attempt at Bangalore, at Manipal Hospital, at the communication station, I was given as with an ambulance driver. He was not getting an understand. Whenever I was asking him, how much do you know about your condition? He was telling me that, okay. Again, I asked him, how much do you know about your condition? Again, he just nodded his head and told me, okay. So better to ask all the questions, better to know what questions you have to ask. Are you getting it, Dr. Shotish?
Yes, sir.
And the funny thing was that at that time, I got a case of hand pain with psoriatic arthritis. I asked him how much these symptoms affecting your joint and job and daily activity. There was no surrogate, and the patient was not getting understand the English well. He was showing me how he drives his motorbike. So based on this, What will be your judgment, Dr. Nahida?
So it will be borderline.
Yes, it will be. Truly speaking, this is a difficult case, but this can be made easy if you revise it repeatedly and practice it.
Yes, sir.
Yeah.
Practice.
Then differential diagnosis?
For differential diagnosis, actually, Dr. Satish gave one differential diagnosis, that was the systemic dysphasic
Yes, better to give other two, like achalasia cardia and diffuse esophageal spasm. But against that, there is no chest pain that goes for diffuse esophageal spasm. Are you getting it, Doctor?
Yes,
Satish?
sir. Yes, sir.
So we have to tell that differential diagnosis of motility disorder that we discussed in our gastroprom session. So based on this, what will be the judgment, Doctor?
It will be borderline.
Yes. Then in the clinical judgment?
Clinical judgment, I will give him satisfactory.
But did he mention to stop the propanolol and OCP?
Oh, yes. As he didn't, I mean, he was out of the Rayner's phenomenon, so he forgot to mention about the beta blockers and the other drugs and other, any vibrating.
Vibrating tool, wearing gloves, safety netting. In short, safety netting was missed.
Yes.
Understood.
This will affect the clinical judgment. So what will be the... Yes, Doctor.
Okay. Safety netting will cut marks in the clinical judgment, not in the clinical patient welfare, right?
No, not in the welfare. Welfare will be affected whenever you are causing any pain to the patient.
Okay.
That is why whenever any patient mentions that I'm feeling pain, stop at that moment and tell the examiner that patient is feeling pain. Should I proceed or not?
All right.
So what will be your judgment in clinical judgment?
I think it will be not satisfactory.
Actually, it will be borderline because he missed the safety netting, but he mentioned the investigation and management.
Okay.
So it was actually hectic borderline. Then managing patient concern.
He made the concerns, so I will give it the satisfactory.
It is satisfactory. And welfare is also satisfactory. So based on this, what will be the total mark from each examiner out of 14?
Is it 18?
From each examiner first. I'm just asking that each examiner has the right to give 14 marks. We have to know how the marks are given. Are you getting it, Dr. Nahida? For each skill, if it is satisfactory, it is 2. If it is borderline, it is 1. And unsatisfactory, it is 0. There are 7 skills. And there will be 2 examiners with this mark sheet. And each examiner has the ability to give 14 marks at best. No one has the ability to give you 28 marks.
Okay. Okay. Well, he had 1 in 5.
Yes. So 5 plus 2 satisfactory.
4.
4. So what will be the total then?
9.
9 out of 4, 9 out of 14. From each examiner. This is a marking from each examiner. As we are dealing with 1, so we can multiply it into 2. Supposing that the marks are given as same from both examiner, which happens mostly, except in few cases. So it will be 18 out of 28. Are you getting it, Dr. Satish?
Yes, sir, I got it.
Don't worry, doctor. It will automatically become okay if you do repeated practice.
Yes, sir. Yes, sir.
So right now, from today on, you have to contact with Dr. Nahida, and Dr. Nahida has to contact with Dr. Satish to practice regularly.
Yes, sir.
Okay. Thank you, doctors. I think no active candidate or type 1 candidates are left to practice. And we are at the end of our GIT practice session. So our next practice session will be on musculoskeletal system. And today you will get access to some musculoskeletal cases PDF. There are about Sorry, what is this? Yeah, there are 31 cases there. These will be your homework, and you will get a separate access of physical examination, investigation, and management for each one. So that's all, doctors. Can I expect any other questions from any doctors before leaving?
Yeah. So I just wanted to ask, how are we going to get in touch with the other person whom we're supposed to practice with?
You have to give a post to the group. Like there are some group members. You can individually poke them that, can you practice with me? Or you can even give a post to your.
Yes, sir. We'll post.
Hello.
Hello, doctors. I'm again sorry, my iPad again hanged. So Dr. Rahul was asking how to do the practice. For this practice, you can give a post to your batch group, or you can give a post to the Secret Fighters group. You can poke individual candidates from your batch, or you can just give a post that I want to practice with your probable time, that I want to practice, I am available at this time. Anyone wish to practice with me from this particular system? Are you getting it, Dr. Rahul?
Yes, sir.
If anytime you face any confusion, just make me a knock. I will be there to solve your confusion. So that's all, doctor. Any other question from any doctors?
Thank you. Thank you, sir.
You are most welcome, doctor.
Thank you, sir.
Most welcome. See you later. We'll more practice. Good night, doctors, and see you all.
Thank you. Yeah. Good night.